member of several government committees and councils. So with that, I would want to invite Mr. Saxena to start this conference today with a welcome address.
Thank you, Akhil. On behalf of FICCI President, the entire corporate leaders, I welcome you all in a very important conference subject matter on safety precautions and safe functioning after COVID, during and after COVID. So, ladies and gentlemen, FICCI is a proud institution to do many reforms during this period. And we have ensured the business continuity of especially the small and medium companies and the large corporations, including some support centers to the government existing programs. My appeal to our chairman, Lieutenant General Bhadwaji, and eminent leaders on the panelist is that this is a reform time when the world has seen the Spanish flu in 1920. And after 100 years, this had been witnessed, this pandemic, which has really installed the world as a still. But thanks to internet and thanks to the technology and innovation, initially it was a shake-up period for a few months, but we then absorb and adapt new technologies for the business continuity, including the logistic and supply chain management. Health had been a very, I would say, very important spoke in every human life, which has demonstrated this, that nothing is important to a human life if you have not having a good health. I'd like to take you to the just about 25 years back. In 1997, we have a great fire in New Delhi in one of the tall building called Gopala Tower. And we lost close to about 103 or 104 human life. That time there was no policy of Fire Protection Act in the country. Under the leadership of FICCI, we had worked with the government and the fire officers to set up a core group to start making the policy for fire regulation. It took us almost 6 years to come up and get the policy cleared from the parliament. Why I'm mentioning it, that the topic is disaster management, and after once the Fire Act has been implemented, today the fire market for the private sector is close to about 1,50,000 crore in India alone. And there is no major fire breakups in small, medium, or especially district industrial centers and large industries. So the time, why I'm referring it, because the time has come for the whole world, and I've raised in the UN platform very recently, to bring a policy on biological attenuator. Biological attenuator. And I'm sure that once any country will adapt this policy, this will open a huge business opportunity for private sector to implement, and there will be minimized risk of the COVID and COVID type of viruses in the businesses or in the houses of the families or in the shops and markets. So what is biological attenuator? I think we have expert and I would say a guru in the India, Lieutenant General Bhadwaj, who had been a member of NDMA. Under his leadership, he had come up with many policies. He got the NDMA Act cleared from the parliament. When General Ved, General Bhadwaj has really worked very hard. Salute to both of them. So the need of the hour is to set up under the FICCI a group with their team members to work out how do we frame a biological attenuator policy, whether this policy is required or not required, and if required, then how do we implement it? So this is, I'm throwing a challenge because this will help the entire country to minimize the risk of such viruses on biological viruses which the country and the world have to be yet to prepare. Now, with these words, I really, from the President of FICCI side and the Presidium of FICCI side, I wish this subjectful meeting a very fruitful discussion. And I urge my team leader, Akhil Gupta, to come out with a recommendation paper on the output of the conference, which can be discussed with the government on record, and we can move forward. I wish all the panelists healthy discussion. And with this, I'll hand over to Akhil. Thank you very much.
Thank you, sir. Thank you, Mr. Saxena, for setting the perspective and sharing your vision on this important subject. We look forward to views and opinions of other esteemed dignitaries during today's e-conference as well. You mentioned the importance of logistics supply chain, how it was kept functional in spite of a disastrous pandemic. Business continuity, as you rightly mentioned, is an extremely important aspect, and a lot of work still is required in that area. A biological attenuator is really, an interesting concept, and under your guidance and leadership, we should, explore the options on how we can implement this kind of policy. So thank you, sir, once again. Moving forward, ladies and gentlemen, we have a special video message from our co-chairman of FICCI's Disaster Management Committee, Mr. Rituraj Mehta, who is corporate head at Safety and Business Excellence at Adani Power, Adani Transmission Limited, and Adani Electricity Mumbai Limited. He has extended his apologies for not being present with us online today due to some extremely urgent exigencies. However, he has been kind enough to share his thoughts over a video message. I request you all allow us to play the video message. Just a second. I would like to thank Mr. Mehta for sharing his thoughts and on-ground experience with us. He emphasized the important need to act differently and follow different sort of approaches to tackle challenges which may vary based on the nature of the business. Laying down of safety protocol and following the same is extremely important, and propagation of a safety culture within the organization is the responsibility of the management. So thank you, Mr. Mehta, once again. We look forward to having you live with us in our future programs. Moving forward, may I now request Mr. Lalit Gabane, Director General, National Safety Council, for the theme address. And before I hand over to him, I'd like to read out a brief introduction of Mr. Gabane. Mr. Lalit Gabane, Director General, National Safety Council, is a C-suite executive with over 3 decades of experience in safety, health, and environment management with renowned companies like Diageo India, ITC Limited, DLF, and HAL in various leadership roles. He spearheaded safety, health, and environment sustainability functions in the FMCG, manufacturing, Alco-Bev industry, paper mills, power plants, high-rise building and five-star hotels, large construction sites. Currently, he is Director General of the National Safety Council of India, a leading national level organization. Mr. Gavane has decades of experience in leading the corporate EHS function, driving performance and achieving zero harm targets for large, diverse manufacturing sectors, hotels, and MNCs. Following global EHS standards and codes, EHS risk assessment, GSA, GHA, ASOP, HAC audits, EHS and fire production, the list goes on. So we are eager to hear you, Mr. Gavane. Over to you for the theme address.
Thank you so much, Mr. Akhil, and very good afternoon to all dignitaries who are addressing today's webinar, and also all the delegates, participants, ladies and gentlemen across the country who have joined this this webinar on safety precautions and safe functioning after COVID. As you are all aware, in last 2 years, the country, and not just our country but the entire world, has passed through very testing times because of the COVID-19 pandemic. And the pandemic has changed the definition of how we live, how we work, and how we survive. Thankfully and hopefully, we are coming out of that. These signs are almost signs are telling that yes, now the world is coming out of that. But until there is a green signal from the authorities who decide we can't consider ourselves that yes, now we have passed through that situation, we need to be cautious. We need to be observing certain behaviors. First of all, my very sincere, hearty compliments to all Corona warriors and to the government authorities for brilliantly handling the COVID pandemic situation and trying to return us back to work. And we are now returning back to work after this pandemic. But it's a new normal now. There are various challenges that we have to face at workplaces, not just workplaces, but even if we go outside to any place. As far as the work life is concerned, I think there are key challenges everyone is facing, in every industry, every individual is facing. While the manufacturing plants, sites, and all other sectors have considered reopening, and most of them have reopened, people returning to work after big breaks can witness major changes in their industrial safety protocols. We have to adapt newer ways of working, because how we used to do work 2 years back, the same ways of working will not hold good, will not be safe. Adapt to new technologies Now take the example, we are using digital technology to deliver this this webinar. Perhaps 2 years back, this was not the practice. We all used to meet in some banquet hall, conference hall, and conduct the seminars, webinars. But the corona has taught us to adapt this digital technology to meet people, to deliver training, to deliver seminars, webinars, whatever. This is just one. But there are several technologies which have now come to the come in the industrial environment, and people have to adapt to them. People have to follow COVID appropriate behaviors, still wearing masks, sanitizing your hands, maintaining safe distances. All that is still required. We have still not come out of that. A lot of our friends are working from home, and ladies and gentlemen, work from home is not all that a fun, is not a pleasure. There are various challenges. We had several accidents post the lockdown, reminds us that we need to revisit our ways of working. The styrene gas leakage, the boiler explosions, and so on. The several fire incidents in the hospitals. They have all taught new lessons what we need to do. And today's safety decision makers who adopt an agile mindset will truly succeed in their endeavors. Even in occupational health and safety, the change will be constant in the near future as health and other staffing needs may fluctuate for longer period of time. It's now well-known fact that more and more industries are taking efforts to get their staff vaccinated against COVID-19, and more employers are asking employees to come back to the office. The same is welcomed by employees, but almost many are now having negative impact on the mental health. And the reason is the feeling of unsafe, feeling of lack of safety. So perhaps the employers need to recognize and prioritize psychological safety alongside physical side of an effective post-pandemic operation. 5 important safety guidelines which every industry need to follow, and they're recommended and they need to follow, is emphasize on social distancing. We can't work the same way where we used to work. The offices used to be crowded, particularly in cities, capitals, capital cities or metro cities. The offices used to be crowded because of lack of space and more number of employees. But now the social distancing has become the norm. So that's a challenge for employers or employees. Strictly in the workplace or shop floor or the construction site, strictly avoid sharing of personal protective equipment. You can't use the PPE of your colleague. You have to use your own. Increasing the hand washing stations has become a challenge. Temperature checks and well-being assessments is must, and limit the workplace visits. This is a challenge. We in safety profession, we used to ask the people in the senior people or the team leaders that have you taken the side rounds. Now there's a different scenario. The side rounds have to be taken, but in a very controlled fashion. The mental health issues due to COVID is a big challenge. Bereavement in the family, isolation, loss of income, and fear of even losing the job are triggering mental health conditions or even exacerbating existing ones. Many people may be facing increased levels of alcohol and drug use, insomnia, anxiety, etc. And COVID-19 itself can lead to neurological and mental complications such as delirium, agitation, stroke, etc. So what are those challenges for mental health or even the challenges in work from home? For working from home people, missing collaboration and communication. When I go to office, I meet my colleagues, I meet my friends, my people working with me. But if I'm continuously working from home, I just see four walls of my house and my computer. So I'm missing that collaboration. I'm missing communication. I'm missing my social contacts, and that is affecting the mental health. Missing that professional environment and learning opportunities which the office provides, which the workplace provides, and especially for young employees and workers. I have seen many engineers who passed out in last 2 years, and they were appointed by or employed by companies, and they are directly onboarded online, and they have been given the assignments or the work online, and they have been continuously working online. They didn't have any opportunity to go to office to see what the corporate environment, what the work environment is like. They're young boys and girls from colleges. They have not seen the workplace. They have not seen the offices. They have not learned, or they are not learning how to behave with the colleagues, how to behave with your seniors. That's opportunity is missing. Loneliness, poor discipline in time management. We are at least in office 10 to 5 or 9 to 6 or 9 to 5, whatever. There is some discipline. With the work from home, that discipline has gone. We need to reinforce that. Distractions at home. In a city like Mumbai, where the houses are very small and a family of 5 or 6 are staying in a 1 bedroom flat or 2 bedroom flat, and there you have to work from home, you have to answer your calls, you have to talk to your colleagues, you have to talk to your bosses. Those distractions are also very much, and those distractions do not provide you conducive work environment in home. And being in different time zone, and particularly for the IT companies, you are in a different time zone than your teammates. Somebody is sitting in America and he's expecting you to have a meeting with you. So these things are actually causing some sort of a mental health issues on the employees. Taking vacation time out is again a issue. So there are, the list can be long, and I'm not a medical doctor or medical professional, so I won't be able to get into much details. But these are what all my observation. So the safety we have done, we have all our thanks to Corona warriors, they have all taught us, and the government authority, they have taught us what precautions you should take. And now we need to continue with that, because the Corona pandemic is still, maybe it has slightly come down, but we do not know when the next peak will come again. So we need to be very careful. We need to adapt to this new ways of working, a new normal, and live life. With these few words, I stop here, and I wish all the best for this seminar. And um, I know there are very learned speakers after me, and definitely they will also address and guide the uh, uh, delegates, the participants in this seminar. And once again, thank you, Vicky team, for giving me this opportunity to speak in this seminar. Thank you so much.
Thank you, Mr. Gabane, for that insightful address. Being at the core of EHS, OHS, and safety, you have certainly brought forth some really useful suggestions and recommendations which shall be really beneficial for our audience. As highlighted by you, work from home is indeed another challenge that needs to be addressed, as it has not been easy and it may have led to deteriorating mental health, which has to be given due attention as well by the employers and the organizations. The need to bring the office decorum and discipline back is extremely crucial for maintaining the work-life balance. Adapting and adopting new technology and solution is certainly the way forward, and workplace safety is indeed the need of the hour to instill the confidence in the workforce and employees. So thank you once again, Mr. Gabane, for that insightful address.
My pleasure. Thank you so much.
Ladies and gentlemen, moving forward, may I now invite our next speaker, Dr. R.K. Ilangovan, Director General, DG Fastly, Ministry of Environment and Labour, Government of India, for the keynote address. Before I hand over to him, a brief introduction of Dr. Ilangovan. Dr. Ilangovan is working as Director General in the Directorate General Factory Advice Service and Labour Institute, Ministry of Labour and Employment, Government of India, Mumbai. He is a lead safety auditor and completed iLab India Occupational Safety and Health Modernization Program Trainer Academy conducted at University of Texas at Arlington. He is an expert faculty in the field of occupational safety and health for various renowned institutions and universities and has been a chairman, member secretary of various committees on OSH formed by the central and state governments. Presently, looking after Factory Advice Service Division of DG Fastly, dealing with regulatory aspects of the Factories Act 1948 and functioning as the chairman of the Academic Council of AFIH course conducted by DG Fastly. Over to you, sir, for the keynote address, Dr. Ilangovan.
So, good afternoon. First of all, I'd like to thank Vicky for inviting me to this e-conference on safety precautions, safe functioning after COVID-19. I would like to thank the organizers, in particular, Mr. Kamal Kishore, Member Secretary, NDMA, Government of India, Lieutenant General Dr. J.R. Bharatwaji, Chairman, FICCI Committee on Disaster Management and former member of NDMA, Mr. Lalit Gavane, my friend from NSC, again, Mr. Ruturaj Mehta, Corporate Head from Adani Electricity Mumbai Limited, of course, Mr. Nirankar Saxena, Deputy Secretary, and the entire team of FICCI. I'm glad to be part of this program. In fact, I was hearing the message from the earlier speakers. What's very important is there's an important concept which we are talking and highly relevant to workplace. In fact, the entire program is on two sectors. One is medical sector and the second is the manufacturing workplace sector. And what we could appreciate is that the COVID has taught us many lessons. And the first lesson, probably after the lockdown and all those things, as for the workplaces are concerned, I'm not talking on the medical sector, wherein the workplace sector, the first problem what we faced was the restarting of the industries. When the industry started restarting after the COVID lockdown, it's a kind of emergency shutdown and restarting. We had come out with a lot of accidents, particularly chemical accidents. And Mr. Gavane also spoke on few of those things, right from, chemical accidents. One of the important is the LG power issue connected with the release of styrene, in which the Andhra Pradesh government has formed a high-level committee, in which as a DG Fatli, I was also a member. And in fact, we came across so many issues, how this COVID has changed the behavior. COVID has really affected the work system at large, which is in public domain. Within 10 minutes, I don't want to take that much time on it. Second important perspective is that we talk about human behavior. We talk about behavior of people. But how this human behavior or the interface of human behavior with the COVID appropriate behavior. This has been a real challenge and it continues to be a challenge and it will have its own impact in a workplace. So whether this COVID behavior, COVID appropriate behavior has gone well with the safe behavior, has gone well with the human behavior, and how to ensure that the safe behavior at a workplace can be further enhanced and coordinated by the COVID appropriate behavior, which is a challenge to every organization. The problem started with the entry procedure, like a workplace when you go with a security check and entry. From there to exit, including the movement of worker inside a factory, the social distance. In fact, we know there were RFID devices, Internet of Things, IoT devices, and artificial intelligence linked systems where we can monitor the movement of people under the COVID condition in a remote system based without affecting the COVID system. We have come across modification of SOPs, standard operating procedures, work permits, emergency procedures, disaster control procedures had to be given a new perspective after COVID-19. All of you will appreciate and agree with me. The entire safety management system, emergency management system, workplace safety management system had to be relooked in terms of COVID. The workplace where people wish to work together, we should think about the social distance, the movement of workers, we should talk about social distance, workplace design, routing, layout, everything had to be relooked in terms of COVID-19. The major challenge was the medical examination. When we talk about medical examination at workplaces, like in occupational health center or the pre and post medical examination, the challenge comes, should we do it? Should we not do it? If we do, what is the effect of it on COVID related issues? And this had been always a challenge. Everybody in the health sector, particularly in workplace, occupational health centers, medical offices, construction and factory medical office, and so on. Even today, we are not in a position to give direction to do medical examination despite COVID. So that's the biggest challenge for every occupational health professional when it comes to workplace. Coming to the COVID protocol, of course, DG Fastly has done a lot of online program. I have exclusively conducted one national seminar on COVID appropriate behavior, impact of it in workplaces. Right from mental behavior, mental thinking process, I shouldn't use the word mental behavior, mental thinking process, and physical behavior, workplace related issues, movements, communication, surveillance, networking, access control. You take any system in a workplace, the COVID-19 has really challenged, modified, reformed, and revised many of the procedures. All of you know the International Labour Organization, including its New Delhi office, we are also releasing a lot of guidelines. I should also like to remind everyone that NDMA, Ministry of Home Affairs, the state authorities, they have gone with a lot of guidelines in handling COVID. As we say, it's a new normal, but again, it is not the original thing. And the safety precautions and safe functionings had to be completely overhauled, reviewed, relooked, reconsidered under the current COVID-19 scenario. And in fact, all of you might be knowing that the government of India has appointed expert committees to frame safety and health standards pertaining to factories, docks, and construction activity. And one of the questions brought before the committee in factories and dock works, which I act as a chairman, was that how to take care of COVID-19 related medical issues. In fact, it's not only COVID. Tomorrow, if there is going to be any other health issue, how these things are going to change, how to address them, and how to look them in terms of the safety and health. This is the biggest challenge. We have also worked and made a standard on how this COVID-like pandemic and epidemic situations can be handled by workplaces, system to relook the complete thing in terms of the learnings that may arise out of a different scenario. We also looked in detail regarding the risk management, which I would like to, all the learned members. Risk management in a workplace with pre-COVID and post-COVID has totally changed as a whole. We need to have risk in terms of this COVID or any epidemic and endemic. And what I would say is the workplaces are not the same one. The systems are not the same one pre-COVID, or the procedures you adopt in a workplace are not the same one. The current and the new COVID, new normal or the expected normal, whatever we say, definitely they're not going to be similar. So all the organizations, workplaces, medical institutions, medical field, or the workplaces have to devise systems. It needs more of a dynamic a kind of a highly accommodative, resilient system we need to develop when it comes to safety and health, considering the epidemic and endemic situation. This has clearly given an opportunity for every one of us to relook the system, shake the old system, and come back with new procedures. And I've seen factories who work with the RFID sensor where it gives signal if the social distance goes on. We have come out with the supervision through CCTV, artificial intelligence-based system instead of human-oriented supervision. We have moved in from worker-oriented operations to semi-automized, fully automized, AI-based machining system, instrumented systems, because we need to protect the human being, and they are being replaced by machines, instrument, gadgets, and of course AI and machine learning. So right from PPE, from head to toe, everything has changed, and everything has to be relooked. My only suggestion to the industry person is that please look all of them in terms of the COVID-19 or any epidemic or endemic situation which may arise. And let's all be prepared so that the workplaces are safer, workers are safer, working community does not face any kind of illness, injury while at work or at work. With this message, I once again thank the organizers for inviting me to give the keynote address, and thank the delegates for their patient hearing. Thank you very much. Thanks to one and all.
Thank you, Dr. Ilangovan. DG, firstly, as we all know, is one of the most important stakeholders as far as occupational safety and health is concerned. Laying down of, as you mentioned, laying down of new SOPs, safety management systems, safety infrastructures, workplace design, deploying new instruments and equipments. These have been some unprecedented challenges that we have been facing over the past couple of years. We still continue to learn and evolve. New strategies and approaches are being followed. Adaptation is the key to a safer and a more resilient workforce and organizations. As you rightly mentioned, risk analysis and management has completely changed post-COVID, and a need to relook and revisit all this has become increasingly critical for ensuring business continuity. So thank you, Dr. Ilangovan, for your keynote address. We thank you once again for joining us today. Thank you so much. Ladies and gentlemen, we are expecting member NDMA to join in very shortly, in another couple of minutes. He was in a meeting right now. We've just got a message from his office that he'll be joining in another couple of minutes. So we're waiting for member NDMA, Shri Krishna Vatsaji, to join for the inaugural address. In the meanwhile, may I request General Bhardwaj, Chairman FICCI Committee on Disaster Management, for his thought on the subject. May I request General Bhardwaj?
So everybody, good afternoon, and once again we have very prominent speakers today, and they have given their very valuable suggestions for before COVID, after COVID safety issues. And as we all know that this has been, we've been discussing this topic directly or indirectly on various issues related to COVID safety. The life as such is totally changed, what was before COVID or what has come up now, for everyone for that matter. You take a group of school children, college going students, people working at the offices, technical people, doctors, paramedics, and so on and so forth. But one thing I have noticed in my experience during being a doctor as well as working in this field, I've noticed that a SOP which is prepared has to be basic, basic guidelines, but then it has to be modified. It has to be modified when it applicable to the school, applicable to the traveling, applicable to the office working, or for that matter, working in the hospitals. But basic issues never change. And as throughout the COVID, it has been stressed that we have to have three principles, golden rules for COVID safety. One is use the mask. No choice should be left on this. Number two, personal hygiene is very, very important for self. It is basically protect yourself. And social distancing. The most difficult part is social distancing. Social distancing at home or at workplace or in a crowd or during traveling, it is almost become impossible. You try to do it, but still the people around you may not do it. So, though we talk social distancing, but other two factors, that is mask and personal safety, personal hygiene, still if you maintain on those, I think a lot can be prevented. Second thing that I have noticed and I want to say today, that the COVID does not spare anyone, poor, rich. You must have heard today's news that even Queen has been affected. She become positive today. So the Queen of England has become positive. Most of our leaders and politicians side have been affected. Doctors and paramedics have been affected. Some because of a professional hazard, some maybe that not they're not taking as precautions because of our systems, because of biggest factor is our population. When you get together, whether it's a marriage or a funeral or traveling in a train or a bus, it's almost impossible to keep all those parameters or SOPs intact as we advise them. But in spite of all these inhibitions and disadvantages, uh, the maintenance of safety issues and uh, to adopt as a normal life culture, certain things have to be imbibed. And if we don't do that, it is not only physical harm to all of us, but there are a lot of mental problems, psychosocial problems, psychological and social problems in our society, which are very vastly seen today. Uh, what you see in general population, most educated people, irritability on the just for a heck of it, people will lose their temper just for nothing, and there are a lot of violence taking place because of this irritability. Not only this, it is also affecting the life at home. Uh, Not because you want to keep a social distancing, but because of the imbibed fear in the mind of every citizen or every family member. You're worried about your children, you're worried about your husband, you have a wife, mother, and father. And I can say for this that first, initial when COVID came in 2000, early 20, that time it affected a large number of population. And especially because we lost large number of senior citizens who had comorbidities, those suffering from diabetes, hypertension, and chronic diseases. They left this world too early, all because not that they didn't take the precautions, but because they had less of immunity and they were exposed to the virus. Even today, if you have comorbidities, if your lifestyle is different, then I think it might affect you again. But if you keep your daily habits like uh, exercise, nutritional food, good nutritional food, and social distancing and your precautions of safety, three golden rules, I think you can still save yourself and not also contribute to the society not spreading the disease. This is one aspect where we medical, of course, today I see in the program that large number of few experts from important organizations and hospitals like Fortis, Apollo, NIMHANS, they are giving their expert talk. Besides this, in the industry, first webinar that we conducted after Visakhapatnam gas leak. And we ourselves had to find out what were the reasons, what were the, why were they not prepared and all. Well, what is one major simple reason that we found out was that we had not left, when the COVID came, we left as such without any thinking that we'll come back again and start working. The moment you start working, your SOP has changed, and therefore you started on the old SOP, and there was a explosion. There was a leak of the gas and fire. So that was a lesson learned, and subsequent to that, I think NDMA and Honorable Prime Minister held a very important meeting. And then we came on to making the various SOPs on running the industry that is safety at the workplace, and newer lifestyle at workplace, working from home for business continuity. Actually, industry cannot really function from home. Only few people may probably senior people might keep a tag on the people who are working. But basically, industry is one place where you, and therefore your SOPs will be entirely different than what office people, basically there's a department or a ministry, or there you can work from home. And though output may not be that efficient as it should be, but still it is workable. But as for the industry is concerned, it is not possible. Similarly, in the hospitals, it is not possible unless you are physically present. More so, your work stress is much higher than what it used to be earlier. I want to say a few words about our forefront workers, especially the medicals and paramedics. I can assure you that having visited a large number of hospitals during COVID, I have seen that the selfless working and devotion that our nurses, our paramedics, and our doctors have shown is unparalleled, absolutely unparalleled. A large number of casualties have occurred in this group. And to come to the term of the living of the family, there is hardly any compensation. The government gives compensation to a roadside accident people. Of course, martyred and all those people deserve much more. But this group also is no less than martyred. They lost their life for others. They took a risk which a soldier will take. So I compare them to the soldiers who fight at the front. And therefore, I only appeal to the general population that please respect them, talk to them nicely, and get the best out of them for care of your patients near and dear. So this area has changed quite a bit of reaction from the doctors to the patient and patients to the doctors. There are a lot of things which our experts will talk, like we have an expert from NIMHANS who will talk on psychosocial and mental health care. Then we also have from Apollo who will talk about strategies of safety and during COVID and things like that. So therefore, those audiences can put questions to them. Our delegates can put questions to them, get the answers. And if still you have any queries, you put on this FICCI website, we'll send you an answer back, certainly after discussing with the experts of concerned experts in the field. It's been a pleasure personally for me listening to Ms. Dr. Alangan, DG Fasli, who's been my friend since long. And he has been contributing to chemical industry disaster management not from today, for the last 10, 15 years. When I have been associated for, he has of course been working much earlier than that. And we have DG NSE, and there's another institution which works quite a bit for safety of the industry in our country. And of course, FICCI team works day and night, even during COVID. They've not stopped working. They've participated with the NIDM to train people, training institution which imparts knowledge for disaster management. They've been working shoulder and shoulder with them, shoulder to shoulder, and so is with the NDMA and other concerned organizations which deal with the disaster management. Well, I think this is time that the FICCI team should compile all the SOPs related to SOPs which have been modified after COVID, because things were definitely have changed, and these are going to stay. If we lose the tag on them, if you become careless, I think one spike, the third spike, and so on and so forth, there is no end to it, because this virus, we all know that it's got a habit of changing its characteristic by mutation. It came as COVID-19, and then came now it is latest is Omicron, and God forbid something else comes later. So, but basic, again, I am talking basic thing will not change. Personal hygiene, distancing, using the mask. So with these words, of course, I would also like to, at the same time, thank all my friends who have spoken, given keynote address as well as inaugural address, both the VIPs. I'm very grateful to you that you've taken time to give your expert opinions and make our audiences very wise. I request Akhil to now please request Krishna Vats to come and address the audience. And with these words, I will probably leave now. And thank you to everyone. Thank you very much.
Thank you, sir, for the words of wisdom and giving deep insight into COVID pandemic, its trajectory, causes, and how we can keep ourselves safe during this pandemic. Thank you so much, sir. So we also have Krishna Vatsaji from NDMA member NDMA with us. So I would like to welcome him. Moving ahead in the program, I take this opportunity to thank him for consenting to deliver the inaugural address. Thank you, sir. We look forward to collaborating with NDMA in more such initiatives to ensure workplace safety and building resilience. Before I invite him, a brief introduction about Krishna Vatsaji. Shri Krishna Vatsa is member National Disaster Management Authority, Government of India. Shri Vatsa has worked in the area of disaster risk reduction and recovery for the last 25 years. Prior to joining as member NDMA, Shri Vatsa worked as policy advisor, Disaster Recovery Bureau for Policy and Program Support, UNDP, in New York and Nairobi during 2015 to 2020. He served as the Regional Disaster Reduction Advisor, South and Southwest Asia in New Delhi from 2008 to 2014. He joined UNDP in 2007 as Early Recovery Coordinator in the Philippines. As a career civil servant, Shri Vatsa joined the Maharashtra Emergency Earthquake Rehabilitation Program in the state of Maharashtra in 1995 and implemented a large-scale earthquake recovery program during the next 4 years. He also served as Secretary to the Government of Maharashtra Relief and Rehabilitation from 2003 to 2006, and then as Secretary Rural Development and Panchayati Raj from 2006 to 2007. In course of his career, he extensively consulted for several national and international organizations in the area of disaster risk reduction and recovery. Krishna Vatsa has Doctor of Science in Disaster Risk Management from the George Washington University, Washington, D.C., and published extensively on the subject. With these words, I would request Shri Vatsa for the inaugural address.
Thank you. Thank you, Mr. Gupta. Thank you very much for inviting me. And I see General Bharadwaj here, so my greetings to him. My greetings to all the fellow panelists, participants. It's a great honor to be here with you. And the topic here is very, very timely. it's very important to discuss how we need to self-regulate ourselves as the COVID is declining in the country. It's a good thing. COVID is in decline, but it is the third time the COVID is declining in the country. First wave, after the first wave and the second wave, and now it is the third wave. So it gives us a relief, respite, and sometimes we tend to relax. But what we have seen that it has come again with a greater ferocity. So we hope that this time we see the end of the pandemic, but if it does not, then we need to remain prepared. What General Bharadwaj just mentioned, we should not reduce lower our guards. We need to be extremely cautious. We need to be well prepared. And this is generally a message that everyone within the government is reinforcing. Please, let's not take it easy just because COVID in decline. And as mentioned by General Bharadwaj again, that we need to always observe the COVID appropriate behavior, and it is incumbent upon each of us to maintain that all the time. It's a responsible behavior. It's a very, very important element of civic engagement, and it shows, it demonstrates our responsibility towards others. So let me say a few things, in this context. Look at how this pandemic has brought a series of restrictions and how the trajectory of those restrictions have changed over time. When the pandemic first struck the country in March 2020, there was a national lockdown, and it was extended to the entire country. All the services, all the facilities, all of them came to a stop. But once we had this experience, and then we had the second wave, you would have noticed that this entire regime of lockdown underwent a very significant change. It was no longer being directed by the central government. It was being directed by the state governments. State governments really took the responsibility for regulating all the COVID appropriate behavior. They were bringing in all the restrictions, curfew, closure. So the nature and scale of the restrictions changed in the second wave. And in the third wave, again, you would find that it has become even more decentralized, because the COVID, the third wave affected different parts of the country very differently. And you would observe that it has become more differentiated at the district level now. The districts are enforcing the changes as per their own requirements. So the broader conclusion is this, that as we understand the virus better, as we understand how it spreads, the nature of virus, we have a better handle on how to regulate ourselves. And it's becoming more differentiated. It's becoming more decentralized. It's becoming more location specific. It's no longer, being imposed across the country, across the states. Within a city, you would find there are different levels of restrictions depending upon how the COVID has spread itself. So basically, the tendency is towards self-regulation. Now, how do we regulate ourselves? And now that the third wave of the COVID is in decline, this tendency towards self-regulation would get further and further reinforced, which means that how at the level of community, households, we are regulating ourselves. It does not mean that we have to reduce any of those restrictions. It just means that the greater responsibility is upon the individuals, households, enterprises, how they are regulating themselves. And this is the message that we need to reinforce ourselves. No longer dictates, no longer those hefty fines, no longer those closures, mass closures. The tendency, the emphasis is on how do we demonstrate responsibility, sense of responsibility in our personal and professional conduct. So from now onwards, there would be much greater self-regulation, and I think FICCI and all the entire private sector should focus on this. We should, whatever we do, we should show an awareness of what COVID-19 has imposed upon us, how to remain safe, how to remain healthy. So that's the broad message, and this is what we need to demonstrate while we continue with our work. We cannot disrupt our professional life. We cannot disrupt our services. The time to maintain the continuity of operations, continuity of business. But while doing all that, we show that personal responsibility. But this self-regulation needs to extend to other areas as well. This is a very important point. This is a point where we are seeing a change in work practices. We are seeing a change in our professional exchanges. We are seeing a big change in the work arrangements, and I think that work arrangement, those work practices again tend towards self-regulation. No longer, do we have to be very strict, very, enforcing about the work practices. I think this is the time to recognize that all of us working are responsible entities. We can observe discipline, we can observe certain regulations, and yet we can contribute enormously to the organization. So I think this is the time to think of a significant change in the work culture, and I think this is where private sector has to lead the way. As I see the unfolding directions of the country, it is the private sector that would lead the development. All our investments are largely spearheaded by private sector. So they have to be a trendsetter in improving the work practices, in bringing greater flexibility, in bringing a greater sense of personal responsibility, and reducing all those elements of coercion, discipline, and all those impositions. So we are entering a new era of work practices. And I think this is where I expect the private sector to lead the way. COVID has really affected us in many ways. More health, of course. Each of us has lost a loved one, and I think I can say for almost the entire country. And it has caused a whole lot of emotional anguish, anxiety, distress. And this is something that we definitely need to reflect upon. The health, along with the health, our emotional well-being, our inner well-being are becoming more and more important. No longer should we think of those practices which lead to stress, which lead to anxiety, burnout, pressures, all those things. We should actually promote something which really leads to joy of work, which leads to fulfillment, which leads to satisfaction. And I think this is a central message of dealing with COVID-19, that there is a lot that we need to change. And this is what I expect the organizations like FICCI and other private sector associations to lead, to develop a kind of culture that fosters these enhanced values in course of work, And we have a much more inclusive society, which have a more healthy society. And and we really care for the people. Caring and compassion for the people actually have emerged as the foremost lesson from the COVID-19. So while self-regulating ourselves in terms of COVID appropriate behavior, these are some of the values that we must foster, and this is something that I would like to share with you. And we really look forward to working with you. We admire your conscientiousness. We admire your sense of responsibility. And we really look forward to a long partnership in this, newly unfolding era. Thank you very much for inviting me and sharing giving me this opportunity to share my thoughts. Thank you.
Thank you, sir. We are extremely honored to have you with us today. Your presence certainly motivates and encourages us. You very rightly mentioned that self-regulation has to be reinforced at every level, at the level of the community, organization, and households, as the greater responsibility lies with the individuals and employers, and all of us to maintain the decorum and discipline. You very rightly mentioned that private sector has to lead the way in improving the work practices, improving the flexibility, and reducing the elements of impositions and restrictions. We certainly need to ensure emotional well-being and mental health, which are important aspects and cannot be ignored in any case. And NDMA is the nodal department in the country for disaster mitigation and management, and has always supported us in all our initiatives and endeavors. We at FICCI look forward to work closely with all relevant stakeholders in the domain towards ensuring workplace safety and health and making the country resilient and safer. We once again thank you for sparing time and joining us today in this important initiative. Thank you, sir.
Thank you.
Thank you, sir.
Much appreciated. Thank you.
Ladies and gentlemen, this brings us to the end of the inaugural session. It has been tremendously insightful for each one of us. We all know that the safer the work environment, the more productive it is. And productive employees are an asset to all the companies, and workplace safety promotes the wellness of employees and employers alike. Before we move to the next session, I would like to take this opportunity to acknowledge our sponsors, Grasim, for supporting us immensely in making this initiative a success. So from our sponsors, we have a small promotional film on the initiatives taken at their end to ensure workplace safety. It's a small clip of around 5 minutes. I would like everyone to just have a look at it. Thank you, Rasim, once again for supporting us in this initiative. Menak, may I request you now to take over and start off the proceedings for the next session, that is adapting employee skills to post-pandemic protocol. Over to you, Menak.
Thank you, Akhilji. It was a wonderful, inaugural session. And now let us start the technical session 1, which is on adapting employee skills to post-pandemic protocol, views from medical sector on safety precautions, guidelines, and the protocols. We have for this session Chairman Professor Surya Prakash, who is the head of Geo-Meteorological Risk Management Division of National Institute of Disaster Management, Ministry of Home Affairs, Government of India. And here we have 4 speakers and very esteemed speakers, Dr. Gaurav Tatia, who is from the Vice President Operations from Apollo Group of Hospitals. We have Dr. Jayakumar C, Associate Professor from NIMHANS, and Dr. Bala Shanti Niketha, Coordinator NIMHANS UNDP COVID Psychological Care Response. We have also other speakers. We have Dr. Jugal Kishore, Director, Professor, and Head of Department, Community Medicine, VMMC and Safdarjung Hospital, Ministry of Health and Family Welfare, New Delhi. And we have Ms. Richa Sengupta, Chief of Strategy and Operations, Fortis Hospital Group. So before handing over to the chairman, let me introduce Professor Dr. Surya Prakash. He is the head of Geometeorological Risk Management Division and at National Institute of Disaster Management, Ministry of Home Affairs. And his specialties include disaster management, landslides, earthquakes, community-based disaster risk management, engineering, geology, environmental impact assessment. He was also the head of Knowledge Management and Communication Division and head of Hydrometeorological Disasters in National Institute of Disaster Management, Ministry of Home Affairs. Over to you, Dr. Surya Prakash, for your address.
Thank you, Manakji. Good afternoon to all. Am I audible?
Yes, sir, you are audible.
Okay. First of all, thanks to Vicky for providing me this opportunity to chair this session, particularly where we are focusing on the medical perspective of the reopening of the industries, businesses, trade and commerce. These restrictions as we are easing down and also ending the COVID-19 restrictions which we had imposed during the past more than 2 years are likely to actually expose us to some new risks as well. Because we remember that when this third wave ended, and we faced the cases of Omicron in December 2021. There were a lot of cases which were reported, and it spread like anything. Though there were less severities and lethalities, but more number of cases which were reported. So now the questions are that if we are opening all our activities and reducing our restrictions, what are the likely consequences? And then second is, if there would be any adverse consequences, how are we going to control those consequences? So what are the cautionary measures, care, and preventive steps that we need to take in order to reduce the risk and enhance the resilience of our population at large? So we got, as Manakji told, 4 experts from 4 different health areas, from Apollo, from NIMHANS, from community medicine, and also from the strategy and operations group. So all of them would be putting up their views according to their experiences, knowledge, information, ideas, and innovations they have. But my one idea I would like to share is that ILO, United Nations, has also issued certain guidelines, because industry has to work according to certain guidelines in such pandemic situations. One of the things we are hearing now is that this pandemic is likely to convert itself into an endemic.
So this may not have further consequences or uncontrolled consequences, but still it will remain there with us. So we need to actually adapt ourselves, as the topic of this current session, adapting the employee skills to the COVID-19 situation, which will remain there for a certain period of time till this becomes a routine affair like other flu matters. So we will look into this, that how we will not allow or let other waves to come, further waves to come, and continue our economic activities with less impacts of the Omicron and a subvariant which is recently BA2 has been reported in India and many other countries. So how all these activities which we are going to start, and the presence, still existence of the COVID-19 variants of concern are likely to affect, and what are the ways and road ahead for us. As in our national policy, we are looking forwards to zero casualty, disaster-free and resilient nation. And in our coalition for disaster resilient infrastructure also, we look forward to the industry to be resilient, as we could see in the video just displayed, where industry has already taken some actions to prevent the impacts. So I think we'll hear more from the experts. But last word of caution, I would say that since IT, IEC, and social media are also very much active these days, so we must look into this, that as said by other experts also sometimes, that this pandemics also has a concurrent infodemics as well. So this infodemics with wrong informations or misinformation or rumors should not lead to the adverse consequences. Particularly the psychosocial issues must also be well taken care, and the changes which are required in continuing our industrial activities should be properly taken care or implemented. With these words, I wish all the best. किसी शायर ने कहा है कि नजर बदलो नजारे बदल जाएंगे, सोच बदलो सितारे बदल जाएंगे, कश्तियों को बदलने की जरूरत नहीं यारो, दिशा बदलो किनारे बदल जाएंगे. So we have to move actually our industries from risk towards safety in a proactive manner, in a sustainable manner, and a safer manner. So adaptation, mitigation, preparedness, prevention are the keys to our disaster risk reduction and resilience. And I expect and hope our deliberations from the experts will lead us the way, show us the path to a destination of zero casualty, disaster-free and resilient nation. With these words, I wish all the best to the distinguished experts of the session, and also urge the delegates and the participants who are attending this session to kindly do ask questions to the experts. But I have a humble submission to the experts also, because we have already spilled over the time almost by half an hour. So I would request kindly try to finish your presentation within 12 minutes, and let's keep 3 minutes for the question and answers from the delegates and the participants. So we will have 15 minutes for each speaker with 12 minutes of presentation and 3 minutes for question and answers. Thank you very much for this opportunity. May I request Shri Manaki to kindly invite the resource person one by one and tell them, the audience, about their background as well. Thank you very much.
Thank you, sir. It was really wonderful hearing you. And the main part of your talk was that we need to adapt ourselves and make industry resilient. That's quite wonderful, sir. So not wasting any time, let me now invite Dr. Gaurav Tatia, the Vice President Operations from Apollo Group of Hospitals. And before inviting him, let me give a small brief about himself. Dr. Gaurav Tatia is an anesthesiologist by qualification and having close to 15 years of diverse and enriching work experience in various facets of healthcare. His MBA education added new dimensions to his skill sets, supplementing practical knowledge with structured frameworks and a strong quantitative ability. He has been driving operations and service excellence initiatives in the unit with focus on continuous improvement in patient's delight. He has orchestrated the commissioning and operationalization of PET suit, robotic surgery, and various technology initiatives at Apollo hospitals. He was instrumental in driving the operations during the COVID pandemic and has been able to manage the hospital operations during the peak of pandemic, ensuring that maximum patients are provided medical care on time. He is also credited with driving digital initiatives at Apollo Hospital. That's a very impressive, impressive biodata of Dr. Gaurav Tatia. Over to you, sir, for your presentation.
Thank you, Meena. Thank you, Professor Surya Prakash, and thank you, the dignitaries and the panelists, for providing me the opportunity to share my thoughts on how healthcare, organizations like Apollo have faced this challenge of COVID. So, without wasting much time, we'll just share the challenges that we as healthcare organization faced due to COVID. So COVID came as a surprise for all of us, and it's been 2 years that we have been facing this challenge. And when it started, it caused complete disruption in the way we were managing our workflows. There was increased mental and physical stress on hospital staff, unplanned expenditure on PPEs, medicines, mandatory PPE, government regulations, and massive shift in care protocols, multiple iterations, and ensuring complete, absolute compliance at every level. So these were the challenges that the healthcare industry faced in March 2020, and it's been 2 years, and things seems to have settled down, but we cannot be complacent. When it started, we had to create a COVID task force, which was a multidisciplinary task force, and it was made sure that we touched upon all the elements and all the levers were taken care of to make sure that the COVID pandemic is tackled and it is sustained also. So hospital leadership, infection control officers, head of departments, clinical experts, everyone came together and regular sessions were conducted, and we made sure that every day we are facing the new challenge with more vigor and rigor and ensure that the patient conditions don't get deteriorate and they get the best clinical outcome. Our preparedness for COVID was multifaceted, ranging from facility and resource-related interventions, process-related interventions, staffing, governance-related intervention, technology, patient-specific. So all phases.
Dr. Tatia, sorry to interrupt. Can I request you to go full screen with your presentation?
Sure. Is it okay now?
Yeah, better. Yeah.
First, the major initiative taken by Apollo Group was Project Covet, which means shield. With this initiative, which ranged from offering technical expertise from prevention to early diagnosis to rehabilitation. This also covered, taking hotels and other hospice facilities for mild to moderate kind of cases so that the hospitals don't get clogged. So this got a great traction during the first and third wave, but during the second wave where the oxygen demand was higher, the outsourced facilities were not too much in use. I just. Sorry, I'm just having some. Sorry, my computer is.
We can see your screen, but it is not, the slide is not moving forward.
Yeah, I'm just trying to take care of it.
Yeah.
Yeah. So the second biggest initiative was the Red Book. So this was the Bible for Bible or a living evidence review that compiles resources from all healthcare authorities, from WHO, from CDC, from Ministry of Health. So we have had 21 iterations till date, and this Red Book contains elements on patient classification, the clinical protocols, the responsibilities, the roadmap ahead, the waste management, all elements of COVID management was present in the Red Book. It was basically a Bible for each hospital, the 72 hospitals for Apollo system, on how to manage COVID. And this came handy during the entire episode, and we are still reviewing it. So with the third wave coming to an end, we are still updating it, and we will be coming out with the 22nd version soon. So the Red Book had thrown elements on the non-clinical management and the clinic protocols, dedicated flow clinic, and all elements which were required for segregation of COVID patients, and also elements of infection control policies and protocols, and training sessions for all the healthcare staff. The Red Book protocol also highlighted the entry and exit for COVID and non-COVID patients, making it sure that they are separate, and also housekeeping kits and other elements were provided so that when the evidence was not very clear about the spread of this virus, so all the areas, all the surfaces which were coming in contact with the patient or any visitor, they were cleaned thoroughly and made sure that whenever we are taking another patient in our rooms, the rooms are thoroughly cleaned and sanitized, so the apprehension of the patient is allayed. So social distancing norms in the waiting areas, in the lift lobbies, and all other diagnostic areas, this was mandatory. During the second COVID wave, we saw a shortage of oxygen. It was to the tune that at one point in time we were almost 4 hours away from completely stocking out of oxygen. But with support of government authorities, we could manage the crisis. But we also doubled the capacity of generation of oxygen at Apollo, and also storing it from 20 megaton to 40 megaton of LMO, and around 3.4 MT of PSA installed capacity was brought to Apollo Delhi. We also created this rapid deployable inflatable structure, which was deployed in 5 days and which could take care of 40 patients at a time. So this was a lifesaver for a lot of patients who came in emergencies, and we could salvage their life with timely intervention and providing them with oxygen and other supportive care. So this also, COVID also gave a push to the entire digital effort that we have been pursuing, and in terms of process automation and digitalization, from patient registration to payments to report generation, everything was digitalized. And with the integration with Arogya Setu and other authority, the guidelines that were shared by authorities, we were able to prevent direct contact of patient with hospital areas. So for the non-clinical meetings and administrative work, we proposed digital meetings, trainings, and this was pushed and reinforced. And to your surprise, we are a JCI accredited hospital. Our JCI accreditation was done for the first time digitally. This was the first time in India where a multi-specialty hospital was audited online because of the COVID pandemic, and we got our accreditation digitally. The key of managing COVID was staffing and training interventions. So because a lot of our staff were getting infected, and because this involved a lot of new infection protocols, reinforcing treatment over 2 years, and making sure that the employee wellness is taken care of. A lot of interventions were taken. Job-specific PPEs were designed. We had a separate Corona Warrior manuals. We were training all clinical and non-clinical support staff to bottom to the housekeeping providers, and the F&B stewards were also given the infection control training. This scheduling of shifts was a major thing because all the COVID warriors had to do 6-hour shifts because we cannot be putting them in PPEs for more than 6 hours. So this was a big challenge, but we were able to manage this also. We had communication tools for all our staff. It was in form of handbooks also and digital also that was shared with all the staff members. In the COVID pandemic brought a lot of mental and physical stress to our care providers. So we did, some interventions around yoga session, leadership rounds in COVID areas also specifically, so that we tell the care providers on ground that we are with you. So the entire leadership would walk in the COVID areas with the PPE so that the nursing and the doctors providing care are feeling motivated. We also had sessions with Sadhguru for some spiritual, enlightenment. Also, to keep the staff engaged, we had quizzes and short film contest so that the fun factor stays. We also organize rewards and recognition for nurses, paramedical, and support staff. And we also had a massive community awareness drive. This was for the internal customers and community at large, the RWS, the public sector unit. So our doctors used to hold digital webinars and e-seminars to educate the people about pandemic, the emergencies that should not be avoided during the pandemic, and how to tackle the pandemic. Corporate wellness programs were really appreciated, where the medical doctors in corporates were educated about the pandemic, and we also conducted some in-house mental well-being sessions. So how do we sustain this? So this is not a one-off. It carried on for 2 years. So we had COVID-specific processes and regular processes reorientation so that we can merge them and the things get back to normalcy. Epidemic management plan were regularly updated, staff training, continuous risk assessment, and sustained focus on quality, process automation, and digitalization. The COVID has not died, so the uncertainty and the anxiety still continues. But we need to remind ourselves that COVID-19 is not a one-off challenge. More such pandemics are going to hit us. So when we are thinking of returning to work, so we need to make sure the HR and the other policies revolve around updated workplace layouts, social distancing norms, education on COVID-19 symptoms, updates to cleaning procedures, and use of masks. And from HR, we need to make sure the employees have their purpose, we identify their potential, and they have their perspective. So we have these 5 R's: reflect, re-engage, reboot, rethink, and recommit. So this is something from an HR perspective on how to go back to the normalcy and re-engage with their staff members so that they think that they are going to be back to post-COVID pandemic era. So the work, like I mentioned earlier, the updated workspace layouts with different entry and exit ways, social distancing, and updated practices. no handshaking, and we should be getting back to our age-old namaste. This has been well appreciated by dignitaries around the world, so probably this is the right time to bring Indian culture back in vogue. And we need to protect all stakeholders. It's not about the staff members, but visitors and all stakeholders who are involved in healthcare or any other work area where people are meeting other visitors. Screening protocols at the entrance need to be reinforced, and symptomatic employees need to be isolated. So, as I said earlier, we need to plan for future pandemics. The business continuity plans, the policy changes, and communication updates. These are the key when we go ahead in post-pandemic era, making sure that business don't get impacted. We are fully prepared for next pandemic. The policies are changed as per the requirement with keeping the employees at the center of it, and regular communication with the employees and the stakeholders on all updates when it comes to any policy change or the regulatory requirement. And to foster that, Apollo has created the Apollo Pro Health COVID Wellness Program, which focuses on patients who have got treated from COVID and want to get back to normalcy as soon as possible. So with this, I would want to thank everyone for giving me the time and opportunity to share my views and Apollo's journey of COVID in last 2 years. Thank you, everyone. If you have any question, anybody has any question, I'll be more than happy to take them.
Yeah, thank you. Thank you, Dr. Gaurav. It was wonderful hearing you. And yes, the question answers we'll take at the end. And you spoke a lot about, challenges faced during COVID, and you have a wonderful slides about returning back to work with the recommendations. You also spoke about the Red Book and the 21st version, and that you are looking forward to the 22nd version of it. So with the permission of the chair, can we go to the next, presentation by Dr. Jayakumar? Professor
Yes, Manakji, please
Oh,
continue
okay.
the presentation.
Okay, thank you, sir. Before inviting Dr. Jayakumar, let me give a brief about Dr. Jayakumar, who will be presenting on adapted workplace. Now, Dr. Jayakumar is a faculty at NIMHANS. He has more than 20 years of experience in psychosocial care and mental health. He has worked in all major disasters. He actually was also working as senior consultant with National Disaster Management Authority on psychosocial care and has coordinated and released many guidelines on psychosocial care. And he's an expert resource person, and he has worked with various ministries. He has been consultant to NDMA, FICCI, various ministries, institutions, and different other associations. Over to you, Dr. Jayakumar, for your presentation. Dr. Jayakumar, am I audible?
Thank you, Mainak. Very good afternoon to each one of you. Am I audible?
Yeah, you are perfectly audible.
Yeah. Respected Chairperson, Dr. Prakash, General Bharadwaj, the entire FICCI team, thank you for giving me this opportunity to come and share a few things about psychosocial care, moreover, the impact and the adapting aspects of post-COVID. So although the safety is the theme of the conference, I actually made it as adaptive workplace. Essentially, they are going to adapt. So let me see whether I'm going to adapt that 12 minutes or so in next 12 minutes. I'll walk you through how we are going to adopt. And the respected previous speakers, including DG Fastly and General Bharadwaj and others, repeatedly mentioned one aspect is that psychological aspects of people who are returning to work and the behavior changes and the issues going to face. So they flagged this aspect very predominantly. So we all know actually that there is a considerable increase surge in the mental health impact of people, both during and absolutely in the aftermath as well. But the aftermath is still obscure and speculative in the area of public mental health concern. And definitely, although the physical epidemic curve has been slided, but the emotional epidemic curve is actually going to come back in the coming days. So if you look at actually the mental health issues, most of the things actually may go undetected, undiagnosed, or untreated actually in the coming days because of number of issues which we will discuss, or I will take certain questions. So, thanks. So definitely any industry, any employee is going to face these aspects. Returning to work itself is a nightmare for many of them because 2 years, very comfortable at home, very informal. You have a lot of time to do the things, and you can also do other aspects. So definitely, actually, all of a sudden, you are returning back to your old routine will definitely actually is going to come back on you and to haunt you. And there is a spurt in the mental distress and anxiety to return to work, and also the fear of overwork. Actually, that today, if they return to work, there will be a fear of overloading, overworking, and many maybe actually want to absent, and also they may be a fear of flexibility. I mean, on-site people may not be that flexible because I mean online there's still actually you can actually have large amount of leverage. And also the one important aspect any employee may face is that the fear of losing autonomy. You are at home watching, doing simultaneously many things, having a sip of tea, you are in your Bermudas and working. So all these are gone. So you're going to be in front of your boss all the time. So you will be answerable for many aspects. And also the ability to perform. So somebody has adopted already to a situation at home and suddenly pushed back to the office where you need to actually conform to certain norms, certain other procedures and processes. Definitely the ability to perform, there may be actually a sort of a doubts among them. And also there is also concern about safety of the family. If I go there, if I mingle with people there at workplace, what will happen to myself, first of all, your own safety, and also if I go back home, whether I may be carrying some sort of a things for my family may get infected. So this is also actually, and losing additional time off actually that many of us had, not me, and many of the people who are from the industries had time off, actually additional time to do various things. So that is all actually going to be a curtains down for that. And that flexibility all has gone. And even many companies provided a pandemic stipend and certain extra things that is also going to be done. So what are all the important aspects, mental health impact? So anxiety is going to be a very predominant in the post-pandemic phase, the panic also, and obviously the depression, it may not actually arise all of a sudden. It may be actually there persistently, slowly actually evolving into later on into a depression sort of a thing. And many of them actually may be going into addiction aspects because they may be using it, or they in the office front they may not be able to use it. So the addiction issues, both tobacco and alcohol, may becoming an issue. And some other things actually, that there is a risk of actually that suicide is also one of the very major mental health impact, which is actually we are seeing globally, and a large amount of psychosomatic complaints also. And important aspect is insomnia. Previously, he might have worked the daytime, so many other things. He must be actually awake in the night to do other things, or there may be actually a change in their routine, their circadian rhythm may be actually disturbed. So now again, they have to put back to the company or the industry timings, norms. So absolutely, actually, that there is actually chances of insomnia and all these aspects. And then burnout is one important issue, which other speakers also actually flagged out. And three important aspect actually comes here. People who are with the pre-existing mental health issues may come back, and if there is actually a chances of exacerbation of these issues post return to work also. So probably at home, they may be on medication, or they may be able to actually take care and support from the family members, but now they have to be pushed into a sort of an work front. So there is actually going to be a distress is waiting for them. And the mental health impact exacerbated by life events means some people might have lost their family members, relatives, or even loss of a job, or even some people have reduced amount of salary. So all these things, and people with chronic illness also, at least for them, it was a succor for them for last 2 years. Now they have to go back to the work. So it's going to actually have a large amount of mental health impact. I'm not going into the statistics and all those epidemiological studies. For us, actually, that we must know what is that actually in store for us if we are actually going into these sort of a readapting to workplace. So we essentially what we have to do it. We need to actually reprogram ourselves. So adaptive workplace is a challenging as well as it's attractive also. You can't actually sit eternally at home. Dependency and childcare and socializing, these are all actually going to be minimized so that your normal routines, the new normal, the old normal routines are going to come back. And the engagement and participation is slowly also going to return. So this pandemic also actually flipped very many traditional workplace orthodoxies, like work has to be done in the office only. No, you can do it at home also. People won't work as hard as, so people worked hard at home, but definitely actually that the same amount is actually being going to be expected or more is expected. And that is where actually that the adaptation and readaptation, reprogram is going to be stressful. And the employee engagement will suffer. No, today actually the technology. So many of the organizations are still going on the blended sort of an approach where both online and offline actually can be done. So it is actually also being taken care. So we must actually also, if you are not only working on offline, we must also enable this technology, take in a technology support to actually provide sort of a supportive this one. So other two things are actually very basic things, and definitely it has actually flipped very many traditional workplace orthodoxies. So from traditional mode to tele mode we went. So each actually requires
Dr. Jaya, sorry to interrupt you. Your slides are not changing. I mean, we are just seeing a stagnant slide. So it's like adaptive workplace. It's not changing. The slides are not changing.
So I'm changed actually. Oh, sorry. Why it is? Just check.
It happened to the first speaker also, sir.
It happened to the first speaker also, but I think my system is not adapting, I think. Sorry about it. Apologies.
No problem. No problem.
So we mean,
Proceedings.
yeah. Can this now?
No, from our end, we are just seeing the first slide itself.
Oh, just a minute. No?
Yeah. Now we can see a different slide.
Okay, so I actually crisscrossed a lot of slides, actually flipped a lot of slides. Like anyway, so this is about the impact which I spoke. This is about the mental health impact which I was talking about, and this is what I was lastly talking about. And definitely the mode has changed, traditional mode to tele mode, and definitely actually that it is possible for us to adopt. So that is where actually that each one of us, the employers, the industries, the administrators, everybody has to actually look for how we can actually collocate this actually aspects. So the adaptive workplace opportunity needs to be brought in among the employees. First and foremost is that other than your tasks and roles and responsibilities, it is also actually important for us to reduce the stress and enhance the better life balance, and continued use of this technology platform along with the traditional platform will definitely improve. So three things I would like to quote here that for an adaptive workplace opportunities, so we need to actually provide them access to mental health information, investing in training and onboarding. So when they are coming back to the work on site, so they need actually training and onboard actually welcome sort of aspects. And so this needs to be actually done very systematically. So I would actually give certain tips to the employees how they can support mental health wise. First and foremost, like our member NDMA told, it needs to have an inclusive sort of an environment. People may claim actually that our organization is like that, but 2 years has changed a lot of things. So how we can actually reprogram our inclusive environment and design return to work plans. Every organization must have design to work plans that not only includes the tasks, roles, and responsibilities, it also talks about the emotional component of the employees and identifying their own needs. Actually, that very, very important. And we need to be actually flexible and hybrid work mode options. And we need to communicate precisely actually that what is that our organization policy is looking at post-pandemic. So also the communicate support that they are not only here to actually take work and show the production, they are also actually there to actually provide a sort of a emotional support. And we must sensitize about positive and negative mental health impact of the employee, individual, and family, and other health, and added to the safety and COVID protocols. So one important aspect is here is that when they are adapting, it may be challenging. So we must encourage positive coping and provide access to mental health information. Today, the number of things are available online. And also, we must also look into certain employees who are at risk, who are all vulnerable, because somebody may be actually undergoing some grief, stress, anxiety, and all those things. So they need to be identified and properly referred and followed them and link them to a mental health resource. And finally, actually, that what I'm showing is that NIMAN's national helpline is there. Today, it is going on in 14 languages for last 2 years, covered almost more than 6.5 lakh calls. And these sort of helplines are available also. They can be actually guided to them. Finally, I would actually like to say here that, like member NDMA said, we need to actually inculcate, nurture a culture of safety, culture of compassion, culture of understanding. Of course, we need to actually bring in resilience. 3 components for adaptation of anybody, that is grit, resilience, emotional strengthening. So these 3 things actually that with this emotional agility, I congratulate and compliment FICCI for providing, integrating, first of all, the mental health component, which is very, very important, because no health is without mental health. And if your well-being is there, your productivity is there. If the ill-being is there, then there is no productivity. With this, thank you very much, and Jai Hind.
Thank you, Dr. Jaya. It was really wonderful hearing you. And as you mentioned that no health is good without mental health. And that's, I think, the crux of your total presentation. And you spoke mostly about the emotional component of the employees. And that's very much essential, because if you are emotionally not well, then definitely you cannot perform at your best. So thank you once again for your talk. And before going to the next speaker, Professor Surya Prakash sir, if you have anything to add, can you add, please, or we will go to the next speaker, sir?
Mainakaji, let's go to the next speaker first.
Thank you. Thank you, Chairman. So let me introduce the next speaker, Dr. Jugal Kishore, who is the Director, Professor, and Head of Department Community Medicine at VMMC and Safdarjung Hospital, Ministry of Health and Family Welfare, New Delhi. Dr. J. Kishore is a medical educator and public health expert. And after completing his secondary school education from Jamia Millia Islamia, he graduated in medicine from Maulana Azad Medical College in 1990 and completed doctorate in community medicine from All India Institute of Medical Sciences, New Delhi. He has more than 260 research papers published in different journals, in magazines, and in dailies. He has authored 32 books and many chapters and pamphlets on public health, national programs, social reform, and rationality. He is a member of many expert groups of health planning and implementation of programs of the central and state government and various institutions. He is a member of many task forces of ICMR and Ministry of Health and Family Welfare recruitment boards, and has conducted more than 50 national and international training programs, workshops, symposiums, conferences. He also got the opportunity to develop the Department of Community Medicine in BP Koirala Institute of Health Sciences in Nepal and the Center for Occupational and Environmental Health at Lok Nayak Hospital, New Delhi. He has worked in various institutions with remarkable capacities. Over to you, Dr. Jugal Kishore, for your presentation.
Thank you, Majumdar. Thank you very much, and thank you, Chairperson, allowing me to speak on this occasion. Yeah. Can you see my slides?
Yes, sir. We can
And
see your
second one also, second, third.
Yeah.
Okay.
Yeah.
I'll
Perfect.
keep in this mode only, because when we go for full mode, then I think there's something wrong. It is not moving.
Fine.
So Surya Prakash ji, thank you very much. And thank you Akhil ji also, who has invited me. Sanjeev is also associated with FICCI. So once again, we are talking about COVID. I think it is now becoming post-COVID. So it's very nice. You feel good that now people start talking about post-COVID or post-pandemic. So we are start declaring, this COVID is over, but may not be, because this disease is such that is going to be with us. And as any invented or new virus which is there now will be there, part of the environment and part of this globe, and many new mutation will come. I keep telling that, if we have 1 lakh multiplication, then one mutation is possible. So this is quite natural, and we have crores of mutation in even one single person. So crores of multiplication. So you can have 1 or 2 mutation. That is why we have number of mutations, and that mutation may be of significant amount, then it become, variant of concern and variant of interest. That may come, but what is learning? I was also part of the MERS and Ebola, pandemic, and at the same time involved directly with the H1N1 pandemic, and we have discussed all these things, But the interesting thing is that we forget very soon. We never learn anything new that should not happen in future, because the H1N1 has also, given some learning, and that learning was, respiratory etiquettes and improvement of the hospitals and private and government and their, attitude and guidelines. And rather, some of the guidelines has been used in, this pandemic also. So that work which was done in H1N1 was, used this time. But the way the society should have changed, I don't think we have, changed a big number or big amount. So let's see that how safety and precautions protocol in medical sector after this COVID is going to be. So all of you know that we have witnessed 3 waves, and the third wave, Omicron, is not as high as, that second wave. But Delhi has witnessed 5 waves. So it's depend on the area and the behavior of people, that wave has been seen. But in overall, internationally also, we find such kind of wave, which is now quite understandable. But this COVID-19 has, affected in many ways, and particularly when we talk about private healthcare sector. And I am very happy to learn from the Apollo and also from Nimans that many activity has been done, and Apollo has given very good, areas of work and activities they are doing. But this was because of the lockdown. Maybe I think we all know lack of transportation and fear of COVID leading to, so many restrictions. And then we have a complete closure of dental OPDs and other OPDs. Rather, private sector is totally closed down, except few big hospital. The solo clinics were totally closed down. Similarly, over the counter, the medicine sale was gone up very high. Self-medication and home medicine, increase manifold. Telemedicine and telehealth, increase again. And we know that how social media has, increased. Then, the postponement of the elective surgery is totally, has been witnessed by everybody. So that has delayed many things. And we have many research showing that how number of, cases of tuberculosis and HIV reporting is, gone down. So it has wide repercussion. Now, I want to highlight here that we have, general workforce, which is greatly affected, and we all witness this, the how lakhs of people have to move. Migrant labor has to move, and we have a crisis in that area. It was never thought of. So in future, if we are planning for the future preparedness of such kind of COVID-like situation, I think we should prepare ourselves for such eventualities. And we all know that healthcare system has the workers, equipments, processes are there, where we are running so many, operation theater or maybe OPDs, and then we have hospital and healthcare environment, which is a work environment, and then we have patients and relatives. So in nutshell, we have, combination of these people who are affected by healthcare. And whenever we have disease like the COVID or H1N1, then we are getting, everyone is getting affected. So we found that actually, if you look at it, we have a shortage of staff just because of the pandemic, because many of our workers got sick. So, and the equipment was not enough because the number of patients increased. So I am going to present you here somewhere, closer to the government setup, not the private one, because the private manage totally differently as compared to the government. So the government situation, you can see in various hospital, although, shortage were there, but they were there who were doing some help to these people. Otherwise, other system was totally collapsed. Then we have no adequate beds and supplies, we all witness. So such kind of, scarcity, which is created by our pandemic, has to be looked into in future. That's what I feel. Then we have the ICUs and various kind of intensive care units, where, the overcrowding was the main cause leading to infection. The transmission was quite high. We have witnessed that number of people have increased much, infections increase in those who have gone to ICU or maybe attending the ICU. The injuries in patient and relative and other thing has increased. By mistake, things are given to patients again. The error was quite high when we have such kind of overcrowding, and a privacy was not there, leading to so many mental and other problems. So this poor infection control and safety was the common feature, and which need to be addressed, not during the pandemic, but otherwise also. We require very good infection control and safety measures, which are somewhere lacking, maybe because of various reasons, but it is there. And you all know that actually our country is having healthcare associated infections quite high when we compare with other country, closer to even bigger country, and maybe I think in some of the Southeast Asia region, we are leading in hospital acquired healthcare associated infections. Then when it is asked why hand hygiene is not practiced, it's a very interesting that there are many reasons, and the reasons are sink is not there, or water supply is not there, the gloves are not there, or the people are not willing to wear the gloves. And sometimes they say that they don't have time. It's a very interesting one. And maybe they have damaged some skin, or irritation is there, because we have witnessed so many allergies are possible when we are using common gloves. So they are reluctant to use the gloves. And they think that every patient, we don't require the gloves. That is why they don't use hand hygiene. So sometimes the patient offended, or maybe I think sometimes you feel offended. So, or you have an attitude that I am not dirty. So that's again a problem. So you can see that we have reasons for not practicing hand hygiene, leading to so much infection transmission during this period. Then we have life-saving equipments and things, which was totally collapsed during this period. So again, we cover up very fast, but during this period, a lot of people died. So what is required is that a basic life support system should be always there, and in sufficient amount. If it is to be arranged. Then we have loneliness, which has been addressed very well. The negative work environment leading to physical, mental health problems, and then we have harmful use of alcohol and substance, absenteeism and lost productivity is quite high. The increase occupational stress, and then leading to so much problems. The time spent or attention or cognition functions of the healthcare worker, particularly doctors, decreases. So it is becoming a cycle, and then more and more problem arise. So this was witnessed during this period also. And we also found that these workers have the emotional turmoil during this period. There are certain jobs which are directly interacting with the patient and relatives, and in front of your eyes you are not able to do certain things which can be done just because of deficiency, or may not be all the things available, so leading to psychological trauma to our workers. So these all has been witnessed, and we had no remedies immediately during the initial period of the pandemic. Rather, first wave we have just without any psychological support, everybody has witnessed. Several study has already documented that we have anxiety, depression. Even ICMI study where we were involved, showing a high amount of the stigma, depression, anxiety among the various group of workers. So that need to be, again, there is another area which is known as a negative pressure isolation. So all the hospitals should have the place where we can, isolate the patient in such a way which is not leading to any kind of further infection to, other. So limiting patient movement or isolating in a, proper place, and you have a structure. So this all structure has been advocated during the H1N1, which I was trying to say. But, when you go to majority of the hospital, you'll not find that we have the, rooms or maybe isolation units which can be used during this period. Then non-availability of the basic support system, rather personal protective equipment, particularly in the initial period. Again, I'll tell you that our workers were not having any such equipment, and they were asked to go to the field, and they say that they will not go. That is why contact tracing was not done. Rather, even up to the end, we were not finding that it has been done properly because of the fear and not having the gear, proper gear, so the fear can be alleviated for such activities. So the emergency and disaster can strike anywhere. We should understand it, and leading to injury and illnesses, the employer and the worker may be required to deal with. So, expected planning is required, or maybe I think we have to have proper plan, proper, preparedness plan and work out, those all things. So planning processes in the emergency or before emergency and after emergency has to be properly done. Although we have disaster plan, but now for infection also we require such kind of planning, and it has been now started. Emergency action plan to everyone in every workplace is the immediate requirement for us, because you never know that this pandemic will continue, or maybe some new variant will come, or maybe some new infection will come. So we have to be prepared ourselves. So WHO already said about this all aspect of workers' health, that is the primary prevention and the protection and promotion of health at the work, improve employment condition and a better response from health system to workers' health. So these four are the pillars of providing, workers' health, which need to be ensured by all of us. So emergency preparedness and response in occupational health, which is now international organization commission has already given that we have to increase the awareness. We have to train our managers, employee and medical staff and mitigate their impact. Everybody should have the access to first aid, and then prevention of physical, injuries or disease and they should include the first aid, particularly very important. And then, multidisciplinary cooperation between occupational safety professional, on one side, and emergency response and volunteer on the other side. So they have to work together to, have a very good system of, management of such kind of, disasters or, emergencies. This emergency plan and procedures like the local legislation is required. So fortunately, we have this Epidemic Disease Act and Disaster Act, and they have been activated, on proper times. And now this, legislation will continue to have activations. So we have very good legislation, but at the local level, some modification is required. So it should be done. Culture, organization specific policies are required, if it has to be done. Then economic background and number of employee, contractor, local emergency medical services, all these things has to be geared up to have the proper response in emergency. Now, this is what, in spite of all what we are witnessing, that GDP percentage utilization, public health is still, 1.2 and 1 point, it has never reached to 2. So in spite of facing such a calamity, our expenditure is still in public health is remain low, and what we are finding that, we are lower than any other, country in the world, except a few. Then what is required, then we have to, give some more, funding for our occupational health provision for emergency, like immunization of our workers, healthcare worker, particularly the training aim at a specific risk, different risk are there in the hospital. So each one should be aware of not only just biomedical waste management, training is enough, but we require hazard assessment and specific training for them. Then, how you are going to use the PPE and access the health promotion activities, there should be there. Many of the hospitals do not have, promotional activity for their own workers. As, Apollo was trying to say that they are having such kind of activity, even for mental health. Then training plan to build and maintain skills, like, first aid course, training for medical staff, the medical emergency drills, and then in, cooperation with the internal, external, rescue teams and other care providers. So we should have an additional reserve staff which are there with the, healthcare, which can always be available. Then, audit procedures and communication line and refresher course, all these are part of the preparedness and training which need to be done. Then prevention of emergency and follow-up, like the risk assessment, not only just physical, but chemical, ergonomic, work organization, environmental, risk. And now the climatic changes is increasing, many times you have the hospital, but you cannot use it just because, all the doctors has gone, or maybe the staff is not there, or maybe your hospital is gone. Hospital is closed down, which has happened in COVID also. So many of our hospitals were totally closed. So that was not a good idea. Then surveillance system has to be established, and psychosocial care. So, only just, resting on NIMHANS is not going to help. We require, all medical colleges, the psychiatry department should be strengthened to handle the, that area, or maybe their own hospital at least, then you can have good outcome. Then special follow-up and use of reporting tools are required. So in COVID-like situation, what is required is prioritizing essential health services, adapting to, changing the context and need of the COVID-like situation. It can happen to other also, optimizing services delivery settings. It should not be that you close down many of the services, and even simple, deliveries are facing problem, or maybe simple diabetic patient, hypertensive patient, and cancer patient were not getting treatment. So that should not happen. Establish safe and effective patients flow at all levels. You have a proper screening, triaging, and targeted referral, and rapidly optimizing health workforce capacity, maintaining the availability of the essential medication, equipment, and supply, even for any kind of surge. So you can see that, these are the learning opportunity for everyone, that, how to deliver the healthcare in such situation. Telemedicine, has come up and we can use more and more. Patient perception is also changed now. They are more focused on the, diseases. They were never knowing, various kind of diseases. The healthcare infrastructure, medical education is totally changed now. We have a hybrid, form of the education, and research is increased manifold. The publication research. So this is, in the end, I can say it's a positive turning point. From this, if we can learn, that is a human health, means that diet culture, your animal and human interaction ecosystem has to improve. Personal and community behavior, food production, environmental factor, which from there the disease has come, how we are interacting with the animal and food production. That is where we have to play. And travel pattern and urbanization. The human science, like the clinical disease etiology, we require, animal can transmit infection, human can also transmit infection, disease coding, public health strategy, all these things are the turning point that we require more and more emphasis on these areas. Then data science, early warning system, and then we have the surveillance system, which need to be strengthened. The diagnostic has to be strengthened. Genome sequencing has come up now very well, and everybody knows that we have to have genome sequencing. So this all is the turning point for health, and we should utilize the maximum. And I think the FICCI can play a role in this, because they can galvanize, at least people to have more, such of these areas taken up and do research and innovations and development, so we can have better human society. Thank you very much, sir.
Thank you so much, Dr. Jugal Kishore. It was a very comprehensive presentation, and it was very excellent, always hearing you. And you rightly spoke about two main aspects, that one is the negative working environment may lead to physical and mental health problems. And the second thing which you have mentioned is pandemic has different types of psychological support, needs psychological support from workers. So thank you so much, sir. Professor Surya Prakash has to, leave right now due to some urgent meeting in Ministry of Home Affairs. So I will now call upon our next speaker, Ms. Richa Singh Devgupta, who is the Chief of Strategy and Operations on Fortis Hospital Group. And before inviting her, let me give a brief about Ms. Richa Singh Devgupta. She is a healthcare management professional with her 23 years of experience and has been associated with some of the leading healthcare delivery brands in India. She has been with Fortis Healthcare for close to 12 years and currently holds the position of Chief of Strategy and Operations with the group. She has completed her master's program in hospital management from the prestigious Indian Institute of Healthcare Management and Research, Jaipur. She has also augmented her training in short-term courses in transformational leadership from one of the best B schools, Indian School of Business, Hyderabad, and AIMA, Delhi. Ms. Richa is the recipient of an award from President of India for running most energy efficient hospitals across the country. She has also been conferred as Best Woman Healthcare Leader by ABP News. Over to you, Ms. Devgupta, for your presentation.
Good afternoon.
Good afternoon, ma'am.
Good afternoon, everyone. So I'm going to be short and crisp because a lot has been said by my previous speakers, and they have highlighted all the important aspects, starting from private sector to government sector, and was very pleased that mental health was part of this discussion. So as some of the speakers spoke about that, what all were the challenges during the COVID time, just to highlight a few, right? The most important was that acute shortage of beds. So I tell you that when my phone used to ring in the middle of the night, I used to be petrified, not with the thought that somebody is calling me looking for a bed in the hospital, but with the thought that would I be able to provide the bed, because I know the person who's calling is really needy and I'm sure is critical to be getting admitted in the hospital. So that was the situation. And shortage of COVID drugs. We all know that starting from we didn't know how to treat COVID, what will be the medicine applicable. We did find our way, but because of the acute demand the production was not there in the beginning. It wasn't really so much that we could provide to all patients, and there was the issue. Slow vaccination rollout, same thing applied to vaccination. While we talk about today, I think I take a lot of pride in our country in terms of the number of people that we have vaccinated. But at the initial stage, it was slow and people were getting panicked and they wanted to get their turn as soon as possible. So that was building pressures on the private healthcare people. COVID positive employees. Needless to say that when pandemic hits, doctors, nurses, and all the other healthcare workers are no exception. They too do fall prey to COVID. And then, the moment they are unwell, even if they have the intent to serve the people, but we can't allow them to do so because of the infectivity. This was an infectious disease, which was to be handled differently. Overstretched manpower. Initially, when the disease started, it was the infectious disease experts, pulmonologists, which is like chest experts, internal medicine doctors. Those were the ones who were treating. And the other specialists were kind of, were waiting and watching that what needs to be done. But at the same time, when there was overstretch of manpower, virtually every doctor jumped into it. And I must mention that surgeons, specialists, they actually were ready to work as RMOs and registrar in the need of the hour. They said, we would be there and somebody can guide us how to treat, and we would be helping our other colleagues who are treating COVID. Severe shortage of oxygen, that's no exception. It is known that some of the cities, some of the states had acute shortage, and that was primarily for the reason it wasn't really anything else. But then where the consumption was 700 tons per day in the country, that became almost 4,000 tons. So it is for everyone to understand that it was the utility which had gone extremely high, and people were finding it difficult to provide that on time. Now, what was the role played by the industry in managing COVID? So we had to be very agile. Reason being that we didn't know what is the next day going to be, how is the infectivity going to increase, what would happen. There would be lockdown, there would be transportation issue, how the staff is going to come back to the hospital, their food, right, so on and so forth. So every day the strategy had to change. We had to kind of rethink. Every evening the management team would meet and decide what needs to be done. Quick ramp up of the beds. Out of 4,000 beds which Fortis had, we could immediately turn around and convert 2,500 beds into COVID. Why not 4,000? One would think. Reason being, as one of the panelists did speak about it, that you have to have negative pressure around those rooms. The AHU has to be different, and at the same time, you had to be prepared to handle the non-COVID work as well, because there were patients from cancer, suffering from cancer, heart disease, and other crucial, disease. Digital healthcare. So one blessing when we say that 1,000 things go wrong when you have pandemic. If there are things which were positive, you can count on your finger, and one was the digital sphere. So digital healthcare. I think it was very good of government to immediately come up with the teleconsult guidelines, and it was rolled out. I think it was a big savior. So I can tell you that the number of consult which we would do per day, around 15-20% actually converted into teleconsult. People were just calling and they were able to speak to their doctors. Robust supply chain. Availability of PPE initially was problem, but then immediately it was kind of taken care of. Rigorous monitoring of oxygen. I remember days when we would get up at 2 in the night, and we were following up with the bureaucrats, we were following up with the politicians to ensure that the availability of oxygen is there in each of our hospitals. And I must compliment, this is one pandemic which has taught us that how public and private can work in a wonderful partnership. If we have been able to phantom this disease, if I could say so, and if there is no wave 4, wave 5 is waiting, I must compliment the way government and private sector has worked together. A compassionate COVID warrior. Initially, there was a sense of fear that what has hit us. But then after that, you must watch when you come to the hospital. You should have seen the way people were working in PPE kits. I'm sure there were a lot of discussion going on that also. People were sensitized, but it was really heartwarming to see how those young nurses were serving, how those young doctors were serving the patients. And I remember that one of the panelists did talk about it and complimented all the healthcare workers who were at the front end and worked during this time. Mass vaccination, we have reached out to the residential complexes, colonies, schools to do these vaccination, and essential non-COVID care that had to be continued, which as I mentioned. Sorry, I forgot to move my slide, but then That's what it is. I spoke about steps taken by Fortis to manage COVID at our hospital, other than what my colleague from Apollo spoke about. What we did is that screening and flu clinic, this was very, very crucial to ensure that there is no mixing up non-COVID and COVID patients. So, I mean, it is obviously you can't say COVID patient, but at least suspected COVID patient when they're entering into the hospital. So there was a mandatory screening in terms of temperature check, physical observation, and before anybody, including the doctors and nurses, were coming to the hospital. Zoning and deployment, the areas were segregated, lifts were segregated, that what would be for COVID and what would be for non-COVID. Central role of hospital infection control committee. So at the group level, because we run 30 hospitals across 13 cities, so there was a central committee, infection control committee, which works in the group. And they were the one who were advising each and every hospital that what will be the protocol and how it has to be standardized and consistent at each of the hospitals. Quarantine and testing protocol for healthcare workers, vaccination for all of them. So we are around 97% vaccinated across the hospital. Staff education and training, that was something which was going on all the time. Focus on clinical excellence at hospital, because a hospital is known for its clinical outcome, its clinical excellence. So obviously in pressure, we couldn't have given away on that. We continue to work on that. As I said, that the core leadership team met every evening to decide on the next day course of action. Other was Fortis Medical Council. So as Fortis operates, it has got 20 of its senior most clinicians, which forms Fortis Medical Council, and they advise on the clinical guidelines to the whole group. There were specialty groups formed because you would have realized that many of the patients would come to the hospitals across different specialty, and they might turn up positive. They came, a heart patient is positive, a pregnant woman is positive. So each of the specialty had to deal with their patients slightly differently, right? And that was the point where the specialty group, the specialist of say gastroenterologists, cardiologists, they formed a group and they came up with their guidelines. We formed all the medical operating protocols. Government were issuing a lot of guidelines and advisory like ICMR and things like that. So that was something which was sent across to all the units and was followed diligently. Further on, I would move on to the next slide, keeping on to the time. Precautions for employee who are returning to work. Screening and monitoring is something which is continuing, and it is advisable that even at the other workplaces, it must continue. Masking and social distances, these are the basic protocols which we have been talking from day one. This is something, again, must continue, and we should not let our guards off. Hygiene, which talks about the hand sanitization. And contact tracing is very, very important, which we have continued to follow. Of course, the contact tracing norms have now eased out, and we follow accordingly. Vaccination is something which is a must again, and continuous staff education. So these are the things which Fortis has done, and I would stop with that. Yeah.
Thank you so much. It was really a very wonderful presentation, and it was great to know the work Fortis has done, towards the medical sector. And the most important thing, ma'am, what you have said is about the overstressed manpower. And that was really wonderful, because at Fortis, at other medical sectors, the manpower was really stressed up. It was not, it is a thing which has to be mentioned, and that's so wonderful. And the other thing which you have mentioned is how public and private work together during this pandemic. That was the most positive side of it. It was wonderful hearing you, and thank you so much for your time, and thank you so much for the presentation. With this, we come to the end of this technical session. And since there is a time lag, we'll straightforward go to the next technical session. And for the next technical session now, which is also very interesting. It's on a very interesting subject. And this is on creating a safe workplace. It's the views from the industries and experts on safe functioning and building resilience for post-pandemic. So we have in this session Ms. Lakshmi Nandkarni, who is an independent director on board at Nelco Limited. She's a life coach, and she's also the managing partner with Gladwin International. Before inviting her, I would give a brief introduction of Ms. Lakshmi Nandkarni. Dr. Nandkarni brings close to 3 decades of corporate experience to human resources function. Lakshmi Nandkarni has spent 5 years in academia at the University of Pune while pursuing a doctoral program in industrial sociology soon after completing masters in sociology and social welfare. Her corporate career began with consumer industry at Reckitt Benckiser in India, followed by the responsibility for heading human resources in Sri Lanka operations. She moved to manufacturing and specialty chemicals, where she spent 10 years, first with the BASF Group in India and later with Dow Chemicals as the HR leader for Dow India. Her last stint before she returned to BASF India as head human resources South Asia was with Pfizer Limited, the Indian subsidiary of the world's leading biopharmaceutical company, where she also held the position of an executive director on the board. So in this session, we also have 2 very eminent speakers, Mr. Ajay Kumar Gupta, Unit Head and Senior President at Grasim Industries Limited, and also Mr. K.S. Harris, Country Group HR Head South Asia, Bayer Group in India. I would now hand over the platform to Ms. Lakshmi Nandkarni for her talk. Madam, I think you are on mute.
Thank you, Dr. Mazumdar, for your kind words. And good afternoon to our esteemed panelists, experts, all the delegates to the conference, and very grateful to the disaster risk management team of FICCI to bring this topic to the platform. Compliments to the medical and healthcare teams which spoke in the technical session 1. I think it was just they touched the tip of the iceberg when they were making their presentations. There is lots that they have done and courageously dealt with the crisis situation that just knocked on us and knocked us out for a considerable amount of time. And they were the warriors. And I think they really deserve a great appreciation from the entire world to have dealt with the situation as the front people. Today's topic, I know that we are lagging on time, so I'm not going to sort of keep you waiting to hear the experts. But the topic of creating a safe workplace and safe functioning and building resilience is very relevant today at the present moment. And the experiences shared by the experts will certainly help organizations to be sensitized to the situation and its needs and give us some best practices that organizations are following and what they may need to be prepared for and do. And it's a continuous improvement, continuous learning. So for quite some time, we've all been talking about the future of work and the future employee profiles and the future workspaces, etc., etc. And suddenly, in the last 2 years, the future is right here in front of us, on our face, much before we expected. So the future is here today in the present time, and we are actually facing that future today. I know that more of such evolution is going to happen and more radical things may come up, but I think that future has already begun, and we are privileged to be able to shape the new possibilities of our work and workspaces because of that. So what are we dealing with? We've had a few stages right from the time the shock set in, when the problems started to sort of surface. It was more of a honeymoon phase, I would say, in the beginning, let's say March or November of 2019 and up to March of 2020. We were in the new phase. We are in it together. Communications, logistics, managers getting used to the new environment, and employers sort of getting ready for what is coming, to address the problems. Then suddenly in the March of 2020, the shock set in, problems became apparent. The work-life boundaries started breaking down. Workspaces started breaking down. and very mixed messages started going from the employers, from the organizations, from the public policy makers to the larger community. And finally, the crisis set in by the middle of 2020. And while we were coming out of phase 1, we were coming into the phase 2 and the phase 3 and phase 4. I mean, we've gone through several phases of the crisis up till now. And then the coping started in the 4th phase, where the companies, employees, and government and everybody adapted very quickly. Human ingenuity always takes over. And we are very innovative and adaptable to the new realities of time, and the new normal started working. Today, I must say that we are in the recovery phase, and we are sort of now getting readjusted to some of the changes, and new equilibrium will start coming, and this is where we are. Okay, in this session, I think we will be focusing on what is at stake for employers and policymakers who are faced with this new situation of reintegrating employees into the offices and making readjustments for a safe workplace after 2 years of separation and radical changes in the work environment and the way we sort of structured ourselves to do the work remotely or in the hybrid model. The population is getting more and more fully vaccinated against the COVID-19. Now, how are employers responding to the phase? The important element here is our preference to well-being identity, which was never sort of looming so large as it is today. The well-being identity is now taking precedence to work identities. The role of employers has expanded in their employees' financial, physical, and mental well-being, which was also not so much in the focus till very recently. So some of the generous organizations have also extended themselves not only to the employee community and their families, but also to the community at large, and have been offering community relief funds and free community service. As we saw in the previous session, some of the organizations have reached out and have had support facilities given to the communities around them. There is a steady rise of employers paying attention to what the employee concerns are today. And what are those employee concerns? Safety, flexibility, and the time that is now going to be sort of negotiated to travel to work. These are the core concerns that I'm hearing and reading, and I've also spoken to a few industry experts. These are becoming the core concerns. And how are we going to support the mental health during the on-site return? As per the recent study of McKinsey, which came up recently, employees are also requesting autonomy in determining when and where work gets done. So suddenly the anchor has shifted from employers making policies to employees sort of demanding, I would not say demanding, but negotiating for better autonomy to where and when they will work, whether they should return to on-site or there is a flexibility available. And the reports say that flexible work arrangements and hybrid work arrangements would reduce a lot of stress for the employees. Having recognized and prioritized on the psychological safety alongside the physical safety of the post-pandemic operations, the employees' mental health and their efforts to cultivate an inclusive workplace. Inclusive is a very key word here because of the space. There's a distance that has got created now. People are working from home, but yet the employers want to make it inclusive, want to be engaging with the employees in order to continue with the well-being, the satisfaction, productivity, and all the necessary factors of engagement. So in the new operating models and the workplace culture that is supporting mental health, a sense of belonging, and flexible ways of working, organizations have become more innovative, and you will be hearing more from the experts on how their respective organizations and the larger community of employers are creating this hybrid work arrangement, because the change of their identity is not now just the change of workplace. You must realize that home was the new anchor for work, or is the new anchor for work, with the office as an additional option and not the other way around. And 2 years have more or less stabilized that kind of a work situation. Now, if organizations want employees to return to work, they're not just changing the workplace, but they're also expecting employees to change their realities and new needs and the new identities if office space becomes mandatory. Employers are now cognizant of the occupational health and safety guidelines, and it is very clear that businesses and employers, particularly HR and the Environment Health Services Department, the Safety Department, play a key role in helping reintegration of employees. So what are those things that we can hear from the experts, and what are those things that are going to be very essential in this is feasibility of social distancing possible in the offices? Are the companies able to stagger employee shifts? Is there a feasibility of accomplishing work remotely? Can distances be traveled by employees to reach the workplace and yet be productive now? Even the proportion of employees living in congregate housing colonies, there are many companies which have housing colonies, or even employees who are living in very congested housing colonies, are they coming with an increased risk of exposure to illnesses? Policies regarding sick leave and other health related policies, are they undergoing some change? Are the employers providing counseling services and constant reminders to employees about the need to monitor for symptoms and also critical behaviors adherence like mask wearing, social distancing, hand hygiene, etc., etc.? Have the employers also considered non-punitive emergency sick leave? Because this was unprecedented and the sick leave was there as a policy. Now there's a need to change some of those policies, and the human resources departments are quickly juggling with some of those changes in the policies and practices to adhere to the public health recommendations. Some organizations which are very forward-looking have also introduced employee assistance programs, which include counseling, coaching, use of yoga, meditation, and other interventions to be able to help manage stress. Have employers taken into account also one very important thing that cannot be neglected is the communication to contractors or contingent staff. While most employers are taking care of their own on-roll employees, are they also extending this support to the contractors or contingent staff? Because they are also on site, there are visitors coming into on site for different purposes. Are they being sort of inclusive about some of these policies? How have they respond to absenteeism at work, while the essential business functions have to continue and be productive? Are there interventions like cross-training employees, etc., to be able to manage crisis? In summary, I think there are three very key aspects that come out. One is the responsibility of individual employees. Two is the responsibility of employers. And most importantly, government policymakers and the support system at a state and national level. Employees have a big responsibility to be extremely sensitive to the situation and take precautions. Organizations are also increasingly more and more sensitive to employee concerns and are reimagining and adjusting and communicating policies on work adjustments. In prioritizing employees' mental health, I think a lot of employers are contributing to improved mental health at workplace apart from reskilling capabilities. Now it leads to a basic question as to what are those policy changes that will need a radical change, like policies on the statutory requirement to work from 9 to 5, or having an office space and things like that. What are the different infrastructural changes and policies that will have to come up? Finally, we have a new workplace purpose with some key elements. How can we continue to learn and innovate and socialize? How can we build organizational culture in this new phase and bring about the sense of belonging? Because employees want to return to a very safe place. How can we enhance employee engagement and positive experiences? And not to forget, how can we provide the unique brand experience to customers in this changing environment? With this, I'm not going to hand it over to Dr. Mazumdar and also introduce the speakers for the session. Thank you, Dr. Mazumdar.
Thank you so much, ma'am. It was really wonderful, you're hearing your talk and you spoke rightly about, the responsibility which is to be, which is for the employees, which is to be for the employers and the government. It was really wonderful. And now let me give an introduction of Mr. Ajay Kumar Gupta, who is the unit head and senior president of Grasim Industries Limited. He was there in the panel for right from the start of this program, but he has to leave right now for an urgent meeting. So in his place, Mr. Shailesh Jain from Aditya Birla will give the presentation. I'll read about Mr. Ajay Kumar Gupta. Mr. Ajay Kumar Gupta has a master's degree in engineering with specialization in industrial production from BITS Pilani 1995 and graduate degree in chemical engineering from Punjab University, Chandigarh 1987. Besides this, he has completed his diploma in PM and IR and a PhD in marketing from Amity University. He started his career in Aditya Birla Group as a graduate engineer trainee at Nagda, Madhya Pradesh towards end of 1987 and grew to the position of Assistant Vice President Technical. Then he moved to PT Indo-Bharat Rayon, Indonesia as Vice President Technical in the year 2006 and was holding a position of Joint President Technical and IR and HR when he opted to move out of the group in September 2013. After serving in Indorama, Polyesters, Nagpur and in April Group Indonesia for 2 years each, he has begun his second innings with Aditya Birla Group as Senior President and Unit Head of Grasim Industries Limited, units Harihar Poly Fibers and Grasilin Division from November 2017. I would request Shailesh Jain to kindly give the presentation on behalf of Mr. Ajay Kumar Gupta. Mr. Shailesh Jain. Mr. Jain, you are on mute, I think so. Mr. Jain, we cannot hear you. Can you unmute yourself, please?
Jan, we can see your screen, but we cannot hear you. Probably you are on mute or facing some kind of problem. Do you want us to share the screen? Is there a problem at your end?
Mr. Mazumdar, if Shailesh is, while he's adjusting his connectivity, can we move to Mr. Harish? Is Harish already there?
Yes, I think we can do that. Manak, till the time Mr. Jain is trying to figure that out, can we invite our next speaker?
Yeah, I think I was in telephone call with him. He's facing some problem with the audio. So, Mr. Jain, I think you can try that at your end, so that we till then we can move on to the next presentation. After that, we can have your presentation. So the next presentation, Mr. Harish case is already there. So the next presentation is from Mr. K.S. Harish, who is the country group HR head, South Asia Buyer Group in India. Mr. K.S. Harish is country group HR head, South Asia for Bayer. In his role, he handles the HR function for India, Pakistan, Bangladesh, Nepal, and Sri Lanka. Bayer has around 15,000 employees and associates in South Asia. Mr. Harish has 29 years of experience in HR across varied industries like pharmaceuticals, FMCG, engineering, chemicals, and technology in both multinational as well as Indian companies. Of these, he has been in Bayer for the last 16 years. His wide experience has provided exposure to business partnering, leadership development, and change management across very different situations and cultures. Mr. Harish has a master's degree in labor studies from the University of Mumbai, followed with a diploma in training and development from the Indian Society for Training and Development. He is an ICF certified coach. Mr. Harish is an avid sports follower and especially a hockey enthusiastic. Over to you, Mr. Harish, for your presentation. Mr. Harish, can you hear us?
So I can hear you. Can you hear me now?
Yeah, perfectly.
Okay, I think there's a little adjustment that I need to do with this particular application. So let's see if this works. You're able to see me as well?
Yeah, we are able
Great.
to see you.
Thank you. Thank you. I'll just share now and let's see if this works, please. Does this work?
Yeah, perfect.
Okay, thank you. Thank you very much. First of all, for the opportunity, and I hope that the technology works out. Lakshmi very nicely presented out the opportunity for companies like ours to really come and share some best practices, and that's what I will try to do. I'll keep it short and only look at three elements if you consider that to be appropriate today. One is, how do we build a resilient employee at an individual level? What are the things that we are doing at Bayer that helps our colleagues be more resilient? The second is, at an organizational level, what are some of the things that we are trying to do? And the third is some practices, some micro practices that builds our culture. So these are the three areas that I would like to very quickly run you through. Is the slide moving?
No, the slide is not moving, sir.
The slide is not moving. Okay.
Yeah.
It's for the first slide. It's for the first slide.
Yeah, but I've tried clicking twice on it. So I think there is some issue with the technology compatibility with us. So I will just see if I can speak without the slides. So that saves you on the time.
Or sir, you can make it not full screen. I think in that way, I think it is going okay in some of the panelists.
Okay, okay, so I'll try that again. I'll try that again. Yeah.
Yeah, this is fine.
This is fine. Thank you for the patience, everybody. Thank you so much. So this is our learning from the COVID times, where some of the things which Dr. Lakshmi Nadkarni was referring to, we did implement in
Sorry,
the past year and year and a half.
Harish, if you can just increase the size of the thing, it's a 67% showing. We can make it maybe 70%. Yeah, yeah. I think this is good. This is good.
Yeah. Okay.
Yes, yes, yes.
Great. So a complete shift of medical and wellness advice to digital platforms. We used a partner with whom we provided free teleconsultations, a lot of wellness and awareness programs for our employees, a 6 weeks long self-care challenge, which actually builds up a lot of competitive spirit in the employees to take care of self-care, their own fitness, and a lot of online posting of what exactly they've been trying to do to take care of themselves. And executive and employee health checkups, which had got to some extent, suspended during that time. A lot of emergency support, all of these things continue so that we can make sure that all this is available even post-pandemic. Support for vaccinations, etc. Special COVID-19 policies. I say policy here, but I go back to what Dr. Lakshmi Nadkarni mentioned, to have more frameworks and guidelines rather than really policies which prescribe what is needed to be done. So a lot of these things are quite flexible. We already had unlimited sick leave even earlier. We've only re-emphasized that. We've also provided for caregiver leaves wherever there is requirement. COVID brought some of these things to the center. It's not that these are required only for COVID related topics. These are required for an ongoing employee all the time. But were we so considerate in the past? I mean, I can put my hand on my heart and say, no, we were not. But this is the time where these things have become primary, and we have moved forward in that direction with a lot of these support. Our EAP, employee assistance program, is continuing to be available. We do see, like many others, a slight increase in the utilization, but a lot of additional work that we believe needs to be done in destigmatizing mental health related topics for people to really be able to use these kind of emotional support areas that we are providing. The companies are providing, but the utilization rates are, kind of not to the level that it might be, that we anticipate might be because of various reasons that, it might not be comfortable for them to use. Continued support on a lot of support hubs and are using our intranet and various other communication medium that we have been using. We have found out in these times that using some of the external apps sometimes is even faster than in-company communication methods. So if there are WhatsApp groups of employees, and WhatsApp is not a formal mechanism of communication in my company, but those are, faster and they're working pretty well. Similarly, when we are talking about safety nets, and that is something I will talk next, which is a voluntary initiative by employees for employees. So one of the things that we found, and we are a multi-divisional company. We have a crop science division, we have a consumer health division, and we have a pharmaceutical division. So colleagues in the pharmaceutical division were closer with ground realities on healthcare professionals, that entire medical fraternity, they are closer to that. They were very, very helpful to the rest of our company by creating these networks across the organization where they work with each other. A dedicated network for each state where we operated across all divisions in that state, and they provided support and information on emergency medical health related support, public health infrastructure. They arranged life-saving medicines on the ground, identified vacant hospital beds for our people. A lot of these stuff also was done in the public domain by our employees, also for other corporates. So one of the learnings that I would recommend for corporates is this network of professionals which can help corporates help each other. It's not only limited within the organization, but across the industry. And groups like FICCI can really help, speed up that kind of collaboration amongst all of us. Resilience for employees. So we rolled out a resilience program within the organization, mainly to say that we have little control over our environment and the challenges that come our way each day. But really, the ability to harness our inner strength to advance despite adversities and bounce back from setbacks, that is really the key for us. So we rolled out a very significant program on resilience for all our employees, but that came coming down from the values of the company. And I think this is an important part. One of the previous speakers touched about the culture in organizations, which is very important. So that's the last stage of discussion that I will have very quickly. The culture comes from our company's values. The values of Bayer are LIFE: leadership, integrity, flexibility, and efficiency. We have just, during the pandemic or just before that, we have relaunched, or we have launched our Life 2.0 version, taking into consideration what modern times require. I mean, the values don't change, but really, how do we need to express those values as part of our culture when we are working in this company? So these are some of those attributes we have put there: play to win, lead with purpose, growing yourself and others, etc., that you see in front of you in that particular slide. Now, coming from there, we ran this particular program on resilience, which was based on mindfulness, habit change, a lot of micro practices so that people can use that on a daily basis. Small moments, they make all the difference. Appreciation and gratitude, which is a big topic. When you make somebody else feel good, you feel good yourself. So we have rolled out 2 volunteering groups, or 2 internal communities, if I were to say. One is a community on gratitude. So these colleagues get together, talk about how, as an organization, we can improve our appreciation and gratitude programs, and they reach that out to through various programs across the company, and that has been very, very successful in this last 6 to 12 months. The second is a volunteering community which goes out and supports the society, so that while giving, there is a great sense of feeling of contribution as well as wellness for individuals. Wellness and health has become an important topic for everybody, and that's going to become also a talent management topic. After this, if I may move on to something that we are trying as part of our daily culture in the organization, we have launched a practices in the organization called #WOW. #WOW. WOW here stands for ways of working. So what are the new habits or the new ways of working that we would like in the company to see? And that is what we have tried to roll out in the organization, so that people can acclimatize themselves, familiarize themselves with what's changing and how is it that we can actually move things forward. In many technology and knowledge-based organizations, the person at the top actually knows the best and knows a lot, much more than many people down the line. But in companies like ours, where we have close interaction with customers and on-the-ground activities, the person who's closest to the customer, closest to the farmer, to the patients, actually knows best. And that is the reason why we are trying to push decision making to that level, that the person who's closest to that decision making is the one who should make that decision. So here is an opportunity for us to build fast, effective, and winning teams that address workload and empowerment accountability issues. Workload has been a big topic all through this pandemic. And while we go forward with the hybrid working systems, that is something where we would like to allow people opportunity through empowerment and accountability, whereby they can be faster, they can put outcomes over process, and thereby determine a faster and quicker decision making for people on the ground. Here are a couple of principles that this might be a little small for you to see, but it's just illustrative for you to possibly imagine what we are trying to do here. So these are some principles that we have laid out. Being purpose driven, as I mentioned, focus on outcomes over process. Processes are important. They hold the structure together of the organization, but put the outcomes over the process. Enable networks. I just spoke to you about those communities that we were speaking about. So make it easy for people to contribute across boundaries. If they can actually provide a lot of support, even if they are not in the same function or department. Distribute authority. Everyone has authority as long as they seek advice, not permission from those affected. So this is a mindset shift, yeah, for people to say, distribute the authority around. Learn by doing. Especially we need to, in certain critical areas, we cannot take the chance, but in customer facing segments and internal improvement areas, concepts like make, ship, learn, and iterate actually keeps us on the improvement cycle rather than trying to perfect something before sending it out. And make information easily available and open by default. So default to open. So these are some of the principles that we have put down. Psychological safety, and that's another area which all the speakers earlier also spoke about. So making space for discussions. Before we start the meeting, what questions are there to clarify? Creating a learning frame, meaning what are we uncertain about? What do we hope to learn from this work? And responding productively. So I'd give you an example of how these practices come and work in the workplace. So there are a series of practices which we use, or we have begun to use. Let me say, with honesty, this is not yet fully implemented in the company. We're all learning as we go along, but I'm just exhibiting one of those principles that I just spoke about, not waiting for it to be perfect, but sharing really, because I think this can help a lot many more people, employers, and companies other than buyer itself. So if you look at this, what is the problem here? What are the practices? So we've laid out a lot of practices that we can use in the new ways of working. Decision rights, for example, when you don't know who's the one who's supposed to decide. So this is the practice to be used. Even overs. I just gave you an example of speed over perfection. So that might be an even over. Team tactics. Working norms are implicit and not widely understood. This is one of the topics into the future. The previous speakers were speaking about continuing future waves, that we've not seen the last of this situation, that there might be more that will come. Speed of decision making, speed of communication is necessary. Working norms, when they will be implicit and not widely understood, it's important to do these team tactics topics so that we can include everyone and they can understand really their roles and how quickly they are supposed to respond. Similarly, there are other practices which are there. I'll save you the time by not going through each one of them. Here are two of them that I want to talk about, which are big contributors to psychological safety. A couple of weeks ago, I was in a meeting and someone suddenly said, ouch. And I looked up and thought, something had happened there. But the point was, there was something happening in the call, in the meeting, which was not, it was a negative comment, or it was something that was not appropriate for the moment, which was immediately called out in a nice way. Now, culture and psychological safety and issues around stress, they develop much closer to the work environment between the manager and the employee than really up the ladder as well. So leaders, they set the ball, but a lot of things happen in that area between the employee and the manager. Yeah, HR cannot only drive the culture. Culture is created in those moments of truth, and if we are able to empower colleagues to be able in a nice way to bring out things that may have negative impact, yet be able to talk about them in the environment and identify and address microaggressions in the moment, that can be a big contributor to the culture. Similarly, inclusiveness and psychological safety, which already we spoke about. A good example of that was the safety net I showed in the beginning. So the safety net was a good example of putting this into practice. Recently, even at the workplace, now that we have started coming back to the workplace, our HSE team has actually put out posters with QR codes to promote observation so that everybody can be involved in the activities that we do. So there's a QR code, you make an observation, you put that in. So an observation a day keeps COVID away, an observation a day keeps COVID away. Now we have to change these into future sounding topics that are important, but quick participation of people in whatever activities that we do is an important part for our developmental journey in these and achieving these behavior-based safety and other outcomes that we want in the new working place. Thank you for the time. I hope it was helpful.
Thank you so much, sir. I mean, it was really wonderful hearing you. And you spoke about the emotional support, that's really wonderful. And you also spoke about the WhatsApp group and how fast you can, communicate among your employees. The best part, what I feel was you spoke about the employee helpline, because that is very much essential during these pandemic situations that your organization is there with you. You also mentioned, sir, that culture comes from company values. That's absolutely true. And one of the most important thing you mentioned about the decentralization of the power and empowering the field staffs with the decisions making. So that also helps to reduce the stress in terms of pandemic situations or any type of situations. That was really wonderful. Now I would request Ms. Nandkani if she has anything to add to, or and then we'll go to the next speaker, Mr. Shailesh Jain. Thank you so much.
No, I think you have summarized well. Harish, as always, comes up with a very, how should I say, very precise and to the point presentations. Maybe at the end, I'll summarize on some of the key points that he has mentioned. Thanks, Harish, for your presentation.
Thank you so much. Thank
you, ma'am. Thank you, sir. Now we'll request Mr. Shailesh Jain to give his presentation.
Hello, am I audible now?
Yeah, perfectly. You are audible, Mr. Jain.
Okay, thank you. Presentation might be visible now.
Yeah, it's visible.
Okay.
It's visible.
So good evening to all the delegates, and thanks for the patience for waiting for our turn. So just to introduce ourselves, we are from Aditya Birla Group, a group which is a conglomerate and having our leadership position in aluminium as Hindalco, viscose staple fiber, carbon black, insulators, cement. These are the few businesses wherein our business ranges from manufacturing, fiber, carbon black, cement to the trading and service sector. The brands through which we are known are Ultratech, Idea, Aditya Birla Capital, Peter England, etc. So from Aditya Birla Group, we belongs to Grasim Industries Limited, pulp and fiber business. Our business has a global presence, having a total capacity of 3,000 tons per day for fiber and roughly 1,800 tons of pulp. So these are a quick snapshot of our manufacturing facilities. The pulp plant, we started production in 1972, and today the capacity is roughly 73,000 tons per annum. We are the only integrated plant in India which manufactures pulp as well as fiber. We started fiber operations also at the same location in 1977 and having a capacity of 95,000 tons per annum. A quick introduction on the value chain as to what we produce and how it is converted into the ready-made garment. So the raw material is basically wood, which comes from the eucalyptus, and finally it is converted into the ready-made garments. So the fiber which we produce is being sold under the brand name of Liva. Our vision to be the global leader in the cellulosic fiber industry, mission to create sustainable value for all our stakeholders. And we are the organization which is driven by the values of integrity, commitment, passion, seamlessness, and speed. Just to coming to our subject now, ensuring safe workplace after COVID. So for ensuring safe workplace after COVID, we framed a multi-pronged strategy to ensure safety of all the employees while returning back to office. This includes mask for all employees, usage of PPE, suits to protect our frontline officers, frequent sanitization, and more focus was laid on awareness and education. So a lot of focus was made on creating awareness and education among our employees, family members, contract workmen, and to the nearby society. A quick view of the processes what we made as to when an employee enters the plant. So how he has to queued up, where he has to sanitize himself, where he has to get his temperature checked, and what is to be done in case if we find any suspected patient wherein the body temperature is more than 98 degrees. So how he has to be taken care. Quick processes what we made volunteers and deployed our security team to avoid any crowding. We made our attendances were made without contact, so there was a contactless attendance punching. Office working was staggered. 100% COVID appropriate behavior was followed. Even the workers followed the COVID appropriate behavior. We staggered their tea breaks. Washrooms were frequently sanitized. Not only this, we also educated our employees as to what to do before leaving the home and what to do when they reach the home. So as I explained earlier, our main focus was on creating awareness and education so that employees can protect themselves, we can help them to protect them, and they can protect their families also. Glimpse on how we created awareness. We made signages, boards at every location wherever the people frequently visit. We made drawings, posters on the wall, and all this was done by our internal team involving workmen, management, everyone in the organization. Apart from taking care of our employees, we also took care of the society nearby. Since we are in a remote area, so it was our responsibility to take care of our society. So during the first phase of the COVID, we distributed ration, we take care of the homeless, given them blankets. Children were given the immunity booster doses, and vaccination was carried out. We also distribute thermal scanners to the nearby hospitals, face mask distribution, and sanitization in villages. Not only this, during second phase also, we contributed and we installed a 600 liters oxygen plant, which has having a capacity of 600 liters per minute in the nearby government hospital to take care of our society. For this, we have also been appreciated by the district commissioners of the nearby villages, nearby district from Haveri and Davangere. These are the few awards wherein our CSR work or for care to society has been appreciated by the different authorities. Now I would request my colleague to take care further.
Actions based on the learnings from different COVID phases, like with respect to plant, we had a bad experience in one of our sister concern, Birla. The working hours, and also we started work from home for so that there will be no direct was the necessity of the day. And SOP for taking the suspected COVID cases to the hospital, dedicated vehicle with medical facility, and stricter COVID guidelines implementation by making various teams, because this was based on the first and second. A few hospitals in the nearby area, some of the beds were reserved for our industry. Support for all the employees, contract workmen. So that was
Mr. Jain, I think your voice is getting cut in between right now.
Acha. So we have a colony in nearby plant wherein around 300 houses are there. We established a COVID care center with 10 beds. There is a CCTV surveillance installed and 100 liters LPM oxygen plant has been also installed there. Now we have done the vaccination for the children as per the government guidelines. And we had conducted various awareness sessions for our colony residents, not only for the staff, even for the workmen colony. And we distributed the immunity drink to the residents for enhancing their. Then we had a lot of virtual engagement activities for the residents because the residents were not allowed to go outside, so we need to like engage them. Now, when we come with respect to this society, we had created oxygen filling facility in our plant because in the second wave, there was a requirement of oxygen because oxygen is used in our plant for the bleaching purpose. So we have created a filling station. So whenever there was a requirement of oxygen from the hospital, we used to fill and send to the like Haveri district hospital. So as we said, we have installed an oxygen plant of 600 LPM at Ranabinu Civil Hospital by spending around 90 lakh rupees. We have provided a separate ambulance for nearby villages. In case of any requirement, we have an ambulance which was given to them. And we work closely with the government so to make people aware about prevention and curing actions.
Now the learnings part. So what are the learnings from the COVID? So the important learnings what we could get out of this 2 years frame of COVID is that there is the importance of the contingency and crisis plan. We need to have a contingency and crisis plan ready to face any emergency situation. Effective utilization of technology. Important thing what we learned is that it is very essential for businesses to work with the society, to work with the community, take care of the community. Compassion and patience are necessary to overcome any challenge. To address anxiety of all the stakeholders, it is very important. And the last is that we have to keep our supply chain agile and nimble so that we can frequently switch over, make changes to our business plan as per the situation. So that's all. At Grasim Area, we believe that safety, health, and environment, these are not only expensive, but these are priceless, and we are continuously working towards it. Thank you. Thank you.
Thank you, Mr. Jain. I think it was a very nice presentation showcasing the efforts you have done already on the disaster management and safety sector. And you have extensively said about what exactly Aditya Birla has done, and it was really wonderful to see your presentation. I would now hand over the platform to Ms. Lakshmi Nandkarni, chairperson of this session, to give her remarks about the presentation.
Sure. Thank you very much, Mr. Mazumdar. I think compliments to both Shailesh as well as Harish for, in a very short, brief presentation, giving us a glimpse of the volume of work and effort that the organizations have taken to, prepare not only the employee, but also the family and the community beyond. Yeah, I think that was the essence of what I heard from both the presenters. From Harish's presentation, and Bayer always does this in great style, is the way they have created the culture of responsibility and empowerment to the employee himself or herself. I think that is an essence of Bayer's, success in being able to make a great progress during the COVID, times and creating a resilient employee. So creating these awareness programs and systematically working on self-care, helpline, support, coaching, counseling, creating the culture. I think the culture is the key word in the whole presentation of how they have created this culture from top to down, down to top, from the community backward integrated into the organization, and from moment to moment, which has established, the kind of practices and it will go a long way in establishing the great practices, and lots to learn from the Bayer group in the way they have managed the whole innovative practices. And from Grasim, Aditya Birla Group, again, one of the most progressive organizations, is with their multi-pronged approach, both at an employee level, at the family level, and at a community level. And I know that they have been appreciated widely by the government and respective departments for having reached out to the community with their selfless service to the community. So some of the SOPs that they have created for the COVID appropriate behavior is something worthy of learning by other organizations at workplace. And they have again, like Bayer, reached beyond the employee at workplace to the families, because they prepare the person when they enter this facility, and then how do they go back, because they can carry something back home, and that learning is of great value to the family, because when you are educating one employee, you are educating the whole family and also the community beyond. So I think both the organizations have had very progressive thinking on this, and some very common facets of what they have done is a strong communication. I think with remote working, the stronger the communication and constant communication with employees and their families has been something that has led them to success. Going beyond the workplace to the family and community is the second thing, which has actually helped the government to make their job easier, because otherwise it was as if the government has to do something, and we will sit down and watch it. The companies have not done that. They have sort of empowered the employees. As individuals, I have a responsibility. How do I empower myself and my family and make the government's job easier? And the third point that came out strikingly from both the organization was continuous improvement, because we were all completely shocked by what we experienced during the last 2 years. Every day was a surprise. How these organizations have stepped up and continuously improved and brought in innovative practices as we go along. I think in essence, some of these organizations have been successful, and lot of learnings is thinking on our feet. Thinking and innovating on our feet has been the principle followed by these organizations, which has really made life easy for both the employee and the families and the communities and neighborhood for this. And FICCI, I think, thank you very much for bringing in these companies, which are really very progressive in their mindset and have created a great workplace for the employees. Thank you very much.
Thank you so much, madam. It was a wonderful, technical session too. We learned a lot from the talk and the presentations. With this, we come to the closer of technical session 2. And now I will request Mr. Akhil Gupta to kindly give his vote of thanks for this e-conference.
Thank you, Manak. So, ladies and gentlemen, this brings us to end of an extremely exciting day. It has been tremendously insightful day for each one of us. Workplace safety has become one of the main priorities for organizations across the world, as safe workplaces are also productive ones. Employers are trying to find new ways to keep their remote, frontline, and in-office employees safe and healthy. Safety in the workplace has significant impact on many business KPIs. In other words, safer working environments benefit from fewer incidents, which results in fewer occupational health costs, better employee retention and satisfaction, less employee downtime, and less retraining time. On behalf of FICCI, I would once again like to take this opportunity to extend our heartfelt gratitude to all the dignitaries and participants for joining us today and making this initiative a success. I also take this opportunity to thank our sponsors for their immense contribution in making this event a success. We had some exceptional presentation and talks from eminent speakers and experts, starting from Sri Lalit Gabane, Director General, National Safety Council, followed by Dr. R.K. Langovan, who together outlined the importance of workplace safety during their respective addresses. Further, we want to thank NDMA for supporting us in this initiative and also extend our gratitude to Sri Krishna Vatsa, member NDMA, for sparing time out of his busy schedule to attend today's conference and address the gathering. His presence means a lot to us, and it also emboldens the resolve of Government of India to tackle this pandemic and any more such crises that may arise in future. Furthermore, Ms. Richa Devgupta, Dr. Katyal, Dr. Jugal Kishore, and Dr. Jayakumar abundantly emphasized and elaborated the important role of healthcare professionals, doctors, paramedics, and scientists in containing this virus and any similar crises that may arise in future. The pandemic did present several unprecedented challenges like severe shortage of oxygen, overstretched manpower, employees testing positive, thereby reducing the available workforce, acute shortage of beds, shortage of drugs, and the humongous task of vaccinating the entire population. We definitely understand the answers were not easy. Medical sector, including paramedics, health and sanitation workers, support staff, frontline workers have played an exceptionally critical role in battling this pandemic over past 2 years. And I take this opportunity to express our deep gratitude to them for their unwavering effort and support. The way our doctors have risen to this challenge is just unparalleled. As our chairman mentioned, the frontline workers, including doctors, paramedics, and support staff, are no less than soldiers and warriors, and we must salute them. It was indeed an eye-opener for us on how tough the battle has been, which still seems to be not over. The threat is still there, and we need to be agile and careful at all times to ensure that we keep the virus at bay. I would also like to thank Dr. Nadkarni, Mr. K.S. Harish, Mr. Ajay Gupta, Mr. Sailesh Jain for throwing light on good HR practices, responsibilities of employer, government employees, and other stakeholders. HR is an extremely important function of any organization. Ma'am, you would agree nowadays the concept of health doesn't refer just to one's physical health. Mental health is equally important. HR executives and officers definitely need to work closely with OHS professionals in the company and actively participate in maintaining workplace safety and also to train employees to maintain a healthy work-life balance. HR can play a crucial role in directing and guiding and laying down a pathway for an efficient and a happy workforce. It is initiatives like Safety Net, Resilience Program, WOW, which Mr. Harish talked about, that will definitely go a long way in sensitizing and building capacities within the organization. We certainly look forward to continued guidance from our experts and panelists in more such initiatives. Last but not the least, I also want to thank all our participants for joining in. I'm sure each one of you must have been really benefited out of today's discussion. Please take good care of yourself, your family members, and keep following the COVID protocol. We at FICCI shall compile all the suggestions and recommendations made by all the experts throughout the day and share with all our participants very shortly. With these words, we would like to end today's discussion and hope to see you online again very soon. Thank you all once again. And just before we leave, we would like to play the film by our sponsors once again for our audience.